Morning. Okay, good morning. Start. Welcome to come. Yeah, I'm Dr. Sanat Samriti, Senior Fellow, Institute for Policy on National Review. And I have been the Deputy Director General of Health Services in the Ministry of Health, retired now. So I've been working there for 30 years. Then I worked for the WHO for 6 years after retirement, and now working for the Institute for Health Policy. So I've been doing this. Now we have two groups here now who are doing the EMSC. I understand that there are from two courses. What is the degree we are doing? MBA. All are MBA group. All are MBA. MBA in health administration. I was under the impression there are two groups, the EMHC group also. One. Yeah. You are from the previous group or? So let me know you, just tell me your name, from where, what's your background, where are you, and sit.
I'm a nursing officer from Cambridge University.
Where?
ITA.
I see. Hospital or clinic? Where? Hospital. Who is the treatment? The previous one went
So I'm working young. At the moment I am working as a youth admission at the University of Kerala.
Yeah, where?
University
Right. So welcome to this module, and so we have 2 days today, and we are meeting again on the 23rd. Right. And this comprises of health policy and yes. We have the remote. Introduce everybody. Introduce yourself, your name, where are you?
I'm from Chilao. I'm working as a health information administrator at private hospital.
Where?
Chilao.
As what?
Health information administrator.
All right. So put on the record mode. what made you follow this? Some different backgrounds and different. Maybe have a mix of both public and private. Recording done again. It's not from here now. Okay, good morning. This module, just to introduce this module on health policy and global health systems. And today we'll be covering mostly the policy areas. And so it's a comprehensive module designed for the health administration program with a view to introduce candidates to public policy formulation. So we'll learn about what policy is and how it is developed, its framework, role of the international organizations in healthcare administration and support, introduction to different health systems in the world, and advantages, disadvantages of the respective systems, measurements of the health system performance. So two things. One, we are looking at the policy part of it. Today we will be focusing mainly on that. What we mean by definitions, various words related to policy development, and then we will look at how a policy is developed and look at some of the policies that are currently there and how they are aligned with the national policies. So that's today's scope, and next day we will be looking at the global health system and what are the different types of systems in the world. We will be looking at about 6 countries and see, and also look at the Sri Lankan health system also. So that's the scope of the work will be there. So those will be covered. This will give you some knowledge and some skills to deal with various organizations involved in healthcare and to work within the stipulated administrative framework of the respective countries with a view to making you a global health administrator, him or her. So you will get an insight into historical growth of public policy. I touch on how in Sri Lanka policies have been developed from the ancient times. Then look at how a policy is developed, and then next day we will look at how the administrative structure of the Sri Lankan health system, and critically look at some different systems in the world, different types of these things, compare it with Sri Lanka, and then also, time permitting, we will go into some national and international organizations in Sri Lanka working towards global international health. So that's scope. So we'll look at public policy, as I said, and then in that definition, some categories of policies. We'll group what are the different types of policies that we have, and so that's, and then and how it related to administration, hospital administration, and so that under that we will be looking at the policy and compare with the regional health policies and importance of health policy for hospital administration and effects of service industry. So thirdly, we will look at the administrative framework, the health system in Sri Lanka, and under that we will do some work and then look at some of the national and international agencies in Sri Lanka, and then look at the health systems in the world. So this is the scope of work. There are some references. I will be loading some of, giving you some of the reading material also. That's a brief introduction to the module. Then let's move into the policy part of it. Okay, so let's look at first look at some definitions and then move on to what determines policies, what are the factors that lead to development of policy. Then we look at what are the goals, what do we expect from a policy by having a policy. And then I'll take you through how a policy is developed, different stages of a policy, and how that policies are put into practice, that is policy implementation, and then evaluate and then time to time how you change the policies, policy reforms. And then also I will talk a little bit about some tools that can be used in policy development and the managerial process of the policy development process. And important thing is another area is policy analysis, what are the different approaches, and in that you can understand. And also I will give you some examples from Sri Lanka. So those things, how those were developed, I was involved in so many policy processes, and concrete examples. I will give you some good policy was proposed to bad ones and what happens and issues that came up because of that. So this range of things that we are discussing today, and so let's start with some definitions, the meaning. What do you mean by a policy? Okay. So, what do you mean by a policy? You go every day. Comes to a country, there are policies now in the country, there are policies for various ministries, there are policies to various institutions have, and individuals also have policies. So what do you mean by policy? What is policy? Any idea? First thought. Your day-to-day talk also, you ask people, Pratipatti hoga. Like when elections come, various parties come up with, this is what we are going to do if we come to power. So that's the political parties, they have a policy. If they are given the task to govern the country, this is what we are going to do. So what is a policy? Is the policy is an action plan or
In order to make it action.
right? Okay, but that is something gives for you to make action, do some action. It's not the policy is not action plan. It helps to develop that. So what is policy is like what?
Set of rules and regulations.
Very good. Yes, some set of rules, regulations, guidelines. So policy is that. It doesn't tell you what to do and everything. It will give you the very broad principles, what is called rules, regulations, guidelines. That's all it gives you. A policy will give you that. But based on that only you have to do your work. Your action plan has to be developed based on that. Right. So policy can be therefore in simple terms a set of principles. Principles. That's what no one. What is your principle? What is your policy of your life? What you want to do? So everybody has principles, and the institutions have, the governments have, right? Okay. And these principles should be linked one to another. You can't have one thing here and something there. All has to be linked. So it's a set of interlinked principles. What do we have this? Why do we have some set of principles? To achieve something, to achieve some goals or so in simple terms, a policy can be defined as a set of interlinked principles chosen to achieve certain objectives or goals. It's not simple. The political parties, they come say, this is, we come to power, this is what we are going to do. Only the principle they will give. They will say, we will give you more jobs, we will bring down the cost of living. So those are principles. That's not, those are their policies. So, simplest way of, there are various other definitions we will go into now. This is a very simplified definition. A set of interlinked principles, all must be related to one another. You can't have something here, something there. It should be chosen to achieve some objectives. Okay. So, these are some of the other definitions. A general statement of understanding which guides decision making. That's another way of looking at a policy. A general statement of understanding. You have come across a policy statement, that is a statement of understanding which guides decision making. It helps you to make decision what you are going to do all that, how you are going to do, when you are going to do all that. Those are guided by the principle, that is the understanding policy. Then Haddad and Ewart says a statement of intent or direction that provide guidance for action and decision. It's the same thing in a different way. It guides you what to do, how we are behaving, what we are going to do. So it's a set of principles, a statement of intent or direction. So policy gives you direction. You go this way. It will not tell you exactly where you have to go, but it will give you direction. This is where you have to go. Right? So then there are another, WHO defines the policy as an expression of goals for improving a situation, the priorities among these goals and the main directions for attaining them. Right? An expression of goals, what you are going to achieve. This is what you are going to achieve if we come to power. Right? Not only that, then they will say, okay, these are our priorities. These are our priority areas. We will improve, give more money for health, education. We will give 100,000 or so jobs to 100,000 people. Like that. Those are broad expression of goals and the priorities among those and the directions. How you that the policy will tell, okay, how you are going to do that very broadly. Okay. So now you have several definitions. You have some idea about what policy is now. Okay. So another way of looking at a policy is a framework for action. Some broad associated rules and regulations or guidelines, principles to do two things. A set of decisions around a public issue. Again, the policies are covering a lot of unemployment, so they will say they are going to give. That's a policy decision that they will come out and tell you. It translates the government's political vision into programs and actions to achieve results. So policy helps you to develop the other things. Based on the policy, they come up with programs and then actions. A set of interrelated decisions taken by public authorities concerning the selection of goals and means of achieving them. Okay, so there are various definitions. Right. Then, do you know many types of policies? What are the characteristics or types of policies? There are some policies which are written down. There are some policies not written down by convention, by practice, people assume them. So we can broadly divide policies into two categories. One are policies which are really put it down and anybody can read it. It's in black and white. But there are policies in summarizing in organizations, nobody can see, but by practice, you have that. Sometimes tea break, that is not even in the description, but by convention people take a in between or the some weekend off or something like that. So there are no listing what you have to put in the listing. So by convention, by practice, but it is not written down anywhere. By practice too. So broadly we can divide the policies into explicit policies and implicit policies. Explicit means it's very clearly written down somewhere. Explicit policies refer to formal decisions and are usually documented. They may be articulated in laws, government orders, ministerial decrees, or published as a manual. So you have sometimes rules and regulations printed and available. That's a policy. Broad guidelines how to run the organization. Or it may be a circular. Secretary has been sent a circular, okay. All the taking hospitals should have the OPD. They want to, people can't sing late 18 late. That's a policy decision, affects only to the health. So the Secretary has the power, and he sends the circular to all the organizations under him. Goes like a ministerial decree or a government order. How does government orders now? Our government makes a policy decision today. And how does that becomes a policy? It has to be documented to be an explicit policy. How do we know? What is the mechanism they use if they make a policy decision? Gazette, right? Suddenly you say, oh, after 12 midnight. No, that's a government order. Gazetted, written down, everybody has to follow that policy. So policies can be in different forms, or it can be laws, or circulars, can be gazette. Right. So those are explicit policies, written down. Other group of policies are implicit policies. They implied but not written down. Implicit policy. By practice, by convention, people assume that thing like that and they work accordingly, according to that. So that's a very broad classification, explicit policies and implicit policies. Then policies can be divided depending on the level of the policy. You can have policies at the highest level, or you can have a policy in your hospital. Are these the same? Can be the same. By definition, it's the same, but there should be a difference between a national policy and an institutional policy. So, policies we can divide into three types. One is at the highest level. Those are called national policies, or usually political statements. Like that, the national parliament makes those decisions. Those are national level policies. Then you have in your hospitals, you have policies about running the hospital. Those doesn't apply nationally. It only applies to your institution. Or the province will have their own policies, provincial policies. So national policies, then you have the next level. The policy has to be converted into what is that? Policies have to be converted to programs. Policies are therefore priority areas. If something is important, they come up with a policy for any priority. So then, to put it into practice, the policy into practice, you need to have some programs. Now, the national health policy says priority is given to mothers and children. That's a policy in the policy document. Most of the policies tell that out very clearly. We will give priority to mothers and children because they are at a high risk group. Now, how can you implement that? How do we implement that policy? Now, national policy says priority will be given to mothers and children. That's a statement in the national health policy. Okay, how can we convert it to the next level, or how can we put it into operation, into action? You need to have a program to do that. Do we have a program? What is the name of the program? To implement the policy that the mothers and children will be given priority. What is the program? What is the program for the mothers and children? You are all with What is the program? I get this, but I need What is the program for the mothers and children? What do we call that? We were here. We created it. Maternal and Child Health Program. MCH. We call it MCH. Now, who runs that program? At the which of level, but national level, what is the mechanism? Who is designing that program, who implements and who evaluates that program? Maternal and Child Health Program. Is there an organization? For some program, we have a separate organization to carry out this. And then we have different disease control program, dengue control program, TB control program. National policy says we control all the communicable diseases. These are the priority areas, therefore we have a program. And there's not only a program, there's an organization also at the national level who will plan, implement and evaluate, run the whole program. Right, so the policy, next level is the program. So, that's the national policy. National policy says only the broad guidelines, it says only but mothers and children will be given priority. Then at the next level, we need to have some policies at the program level. The program, MCH program has their own policies. Can you tell me some broad maternal and child health policy in the program? Immunization. Say children should be given according to the schedule age appropriately. So that is a policy, program policy. That is not told how to give the immunizations in the national policy. But in the program policy, it spells out, okay, at these ages, we have to, okay, now the policy, the program policy, the national policy or the political statement, this thing at the national level, then they are converted, then at next level we have program policies. Those are programs, specific to the program. Then, who puts it to practice? National policy says mothers and children will be given priority. Then the program, MCH program says the children should be immunized according to the schedule. Right. Okay. Then there must be a policy how to do that. Where do we have that policy? Who do that? Who deliver that? Who do the immunization? Yeah. MOH at the T is responsible. Right. The other people at the community level, they deliver. So you have policy, they have policies. They are how to do that. How to maintain the cold chain. Monitoring and then the vaccine that we put into from the refrigerator, you have to maintain that. Those are all policies. And then the vaccine carrier, you have put it in that, and with the ice you take it to the site is there. And then how to give it sterility, there are policies. How to maintain sterility, you have to wear gloves. So what are those policies? What is the name we can give? We have national policies, program policies, that you put into a practice, are called implementation policies, so you can call it operational policies. So at the operational level also we have, so we can divide policies into 3 levels, according to 3 levels: national, program and operation. So policies at the national level can be divided into 2 major categories. These are political statements, those are national level. Right? The mandate, the political mandate, the party, those are national level, which applies to the whole country. Political statements which provide general direction for the achievement of policy goal. And then the next level is the managerial policies or program policies. You can call it managerial policies or program policies. That is the next level. Political statement has to be converted into action. That is done by the program or the management. And then made up of strategic policies, and then finally you have at the operational level or the implementation level, we call them operational policies. Right? So first we divided policies into 2 categories. What are the 2 categories? Explicit and implicit. Then we divide it into, depending on the level of the policy, national level of political statements, then program, and then operational one. So many people mix this up. They don't know policy is policy for them. I have seen this in the parliament. We go for the budget debate. Right? Sometimes some ministers have seen. They seeing the document of the previous government, say that the previous government had only a 5-page policy document. And they show and then big document and say, we have developed a, they don't know that there's a 2 different one. The national level policy should be a very brief statement. So it's part of the state. It's not a big document. You can't have everything in the policy. So next one is the program policies. Okay, that needs to be spelled out in little detail because so many things are there. Then when it comes to operational, still more detail you have to give. Excellent. So policy means, so they don't understand the difference. So now you understand what the national policy is, program policy and operational. All are policies. Our people, policy is a policy, everything is one. So they don't. So there's a difference. Different levels. Okay. Now let's move. Yes.
Questions regarding implicit policies. Now, since it's not written down,
What?
implicit
Implicit policy.
Yeah,
Yes. Yes.
it's not written down.
Not written.
So, in case, let's say if there's a deviation or a person who's doing something out of the box,
Yes.
I mean, you can never challenge it in a court of law. I'm just trying to clarify.
Yes.
Yeah?
Yes. Yes.
You can't. You
Yes. Then
can't.
they go to an inquiry and
Right.
look at the circumstances and the practices, and then they give a
Right.
decision.
Okay.
So you can give it the evidence, but they are no written. They are written thing, it's
Yeah,
very
you
easy.
can't. Yeah.
With black and white, you know. So these that's why a lot of fights and things are there because grey areas. People interpret their policies in different ways. Right. So policy development, health policies cannot be set in a vacuum. You can't just out of the blue come and okay, we want to develop a policy. You can't do that. You must to start with some problem, some issue. There must be an issue. Policies must reflect the social values and principles with regard to health, life, reproduction, welfare, and equality of opportunities among others. So many things. You can't. That's why you cannot set up a policy in a vacuum. You must should reflect the other things also. Economy, all that. So, what determines a health policy. What are the factors that will lead you to come up with a health policy? You have all determinants. What factors will determine that you come up with a policy? Why your policy should be there? What are the factors? What is the first thing? How does most of the policies come? Who decides? Who decides most of the time? Yeah. Who say we want to have a policy national level and come up decide? Yeah. Yes. Who run the country? So the politicians, right? So political people, they sometimes decide, okay. So then what are other things? Yes, other. What do you mean by the environment? The living environment, the economy, right? Those factors, socio-economic environment, referring to the socio-economic environment, that determines the policy. Depending if the people are poor, then you need a policy to improve their living status because of the when we become a developed country and see new issues coming, so then you need to, depending on that environment, we need to come up with some policies. Expressways here. Now we need to come up with some other policies where toll gates are. So those are policy decisions based on the, earlier we didn't have that. Now with the changing economy and the development, socio-economic factors. What else? Yeah?
Social stability.
Yes, that's socio-economic means all that, socio-economic means all that, the income level, the resources available, all that. So political factors, socio-economic environment, what are other? Health, when it comes to health, why do we need policies? Now the coronavirus has come. Suddenly they created some policies. Yeah, the demand for care. That will determine if some new disease comes or new health issue comes, we need to come up with a policy. There was no policy for accident and emergency. Yeah, with the accidents going up, there was a need for we had only the accident service in Colombo. Now they have a policy which tells you that any hospital should have, now private sector of course have A&E department, but in the government hospitals, how many have that? Now they have a policy, help them develop that policy and then it spells out, this is the facilities should be available depending on the type of hospital, those are flexible. So the demand for services, that will also determine. When dengue in 2002-03, dengue was raising its head, there was no control program. So we made a decision, national level policy decision, we will establish a control program. And now we have a dengue control program because the demand was there. So increasing problem. So you need to, the demand, that is the first thing, the demand for healthcare. That will determine. Now we might have to have some policies with regard to this quarantine and improve those things. So political pressures, essentially, political pressures, right? And then you have to think of the national priorities. You can't have policies for everything. It has to be the priority. If there's something national priority there, right? So in the education sector, they said now a lot of people are dropped, only out of several lakhs, only 30,000 are selected to the university. Others are qualified to have a university education, but they are no facilities. So now the government has made a policy decision, they are going to absorb all the people and giving status, leadership status to other training trainers and develop their skills. So, national priorities. We want to have a skilled workforce. So then therefore, we need to improve the details. So those are national priorities. And then the socio-economic conditions, what you said, determines the policy. Depending on that, if it is changing, then when we were a developing country, the policies were, we had to run poverty alleviation programs and things like that. New programs, so obviously still we have what to do when the Samut program was introduced. So, changing social. And this also the international agencies, they also come with that. They also have their agendas. Pursue sometimes. Those days, of course, World Bank, IMF was telling you do this. Sometimes we have done that, got into trouble also. They were said to reduce the public service. They will give loans and grants. If you scale down the so we scaled down sometimes, we didn't recruit and we now, of course, that we don't listen, directly take what they say, argue out and take what is needed for the country. So, but sometimes we agree that great position, they also have funds and things to get that, if it is a priority. So, international agencies' priorities also determine sometimes. Now IHR is international agency. WHO came up with international health regulations in 2005, revised the earlier one. And because that was in place, we were able to contain this coronavirus. We adapted that after 2005, Sri Lanka, and we followed those policy guidelines. Quarantine at the airports, all that. So, because that we were able to implement those things, restrict people coming in, screen people, all WHO has spent out. IHR 2005. So these are the 5 determinants of policies. These will lead to policies. Okay. Now, next is what are the goals or what do we expect from a policy? This is the factor that leads to a policy. Okay, we have policies in place. What do we expect? Why do we have policies? What is the expectation? What do we want to achieve by having a policy? Those are the policy goals. There are others also. These are the 5 important ones you have to be. There are 5 basic goals. Why we have a policy? What do we expect by having a policy? What do we expect from a policy? Why do we have a policy? Yeah. Right. If those guidelines, regulations are not there, what will happen? So what do we expect by having a policy? Policy will help us to efficiency, yes, efficiency. Right. It will help us to be more efficient. Otherwise, people work the way they want. So one goal is to make things efficient, to function efficient. There are 2 types of efficiencies. Anybody knows? One is called the allocative efficiency, other one is called the technical efficiency. You will learn that in your economics module in detail. Allocative efficiency means how you allocate funds. you have several programs, so you allocate, you will give you the best results. Sometimes some people allocate useless program more money and a very useful program which will give you that. So that there's no allocative efficiency because although you put in money, that's not output is not good. So how do you allocate, that is called allocative efficiency. Other one is called technical efficiency. Technical efficiency, you say you have 2-3 methods to do something, so you select the best method and allocate resources for that intervention. Technically sound. Right. So, what is the first main thing important? Why we are there are people in the whole country. So if you come up with a policy, what is the main thing? Yeah, what is the most important thing? If the policy favors some part of the people, then people will protest. So therefore, policy should be equity. Everybody must be treated equal. When we come up with a policy, if it favors some ethnic group or some religious group or some economic group, or if it favors only the rich people, then that is not a good policy. Policy should be there to serve everybody equally, treat everybody equally. So that is the first thing, fairness of the policy. That's why we have a policy. There's no policy. People do what they want. That is the first thing. We have a policy. Policy will make equitable to everyone. Now, how does that has made in the health policy? What is the most important thing which helps in equity? But in the national health policy, the main thing in the national health policy that helps to achieve this. What is the health policy? The national health policy. All the governments stick to that. They don't change that policy. They try to, one government tried and they lost the next election. What is the in the health policy, national health policy, which cuts across, everybody is treated equally. No, please. What is the policy? What is the most important thing in the policy, national policy? For health care. Free health care. Free health care. So if we say we are going to charge fees, then it is not equitable. Poor people can't get the services. Only the rich people can get the services. So there's no equity. They started with the 25-cent stamp, and the government had to go with the 50. People are so used to the free services. No government will touch that policy. That health services will be provided free of direct cost to the user. That's basic equity. Anybody can walk into and get it, whether you have money or not. That is fairness. If you start to introduce a user fee charges, then poor people can't access the service. That's no. So equity. Then your efficiency, I said 2 types of efficiencies, allocative efficiency. You must allocate money so that you get the returns, the best return. And the other one is the technical efficiency. You must put the money where it works properly. Technical efficiency. Then what is the fourth goal? What do we expect? For whom is all the health services are there? What is the ultimate goal that we expect by providing health services? The policy but policy should lead to what? What is the ultimate aim? Who are the beneficiaries? People. So what do they expect? How do we measure satisfaction? That is very important. Client satisfaction, community satisfaction. That should be the main policy goal. If you have policies which people are unhappy, then that's not a good policy. That's why the policy should lead to that people are happy with services. And then finally, that's another important factor, now becoming more important. Health services should be what? Quality of care. That is now we are going forward. That is another goal. That's why we need to have policies to achieve this policy goals. Quality of care. Right. So this is what we expect from a policy. Earlier we discussed 5 things that determines a policy. These are the goals what we expect from a policy. So not to cram up just think that policy should treat everybody equally, fairness. Then policy should be efficient, allocative efficiency, technical efficiency. People should be satisfied when you introduce a policy. That's why some policies people propose some trade policies. ACTA and all those things. So, and then the important policy is there to improve the quality. If you don't have policy, quality will not be. That's why we do various standards and try to improve the quality of care. Okay. So, health policies determine the current health priorities. On the other hand, new health priorities determine the health policy. It's a chicken and egg sort of story. If there's a pressing problem, priority problem, then you would have to come up with a policy. The accident and emergency policy, I told you. So the policy now when the motorcycles use was going up, a lot of people had got accidents. And when they realized, most of them died because of accidents. Then what did they do? What did the government do? Introduce a policy that all motorcyclists should wear a helmet. So priority, policy. Sometimes you come up with a policy that becomes a priority. Okay. So policy development starts with you have to look at what are the priorities, important areas. You don't come up with policy for each and everything. Some people come and suggest various things which are not important. So it should be a priority area. And you have to have some technical criteria for that. Health status of the people. Cost effectiveness. You don't just bring in policies unless it is cost effective or the money you put in and you get the results are better. Sometimes some people, the politicians also try to bring in some, when we have done that also, the benefit was not in terms of the amount of money spent. So policy, they notes now that going 1 hour so policy decision to buy those things. They are not paid notes. Community preferences. Because policy has to make the people satisfied. Community satisfied. And then you have to look at the feasibility also. Just bringing in the policy will not help you. What will happen is when you bring the policy, whether it can be put into practice, that you have to consider. Health system capacity, whether the health system can have the capacity to address that. Do we have enough staffing? Financial prospects for the health sector, how financial listing, and then also political acceptance. Sometimes they are the ultimately make the decision, so it should be acceptable to them also. So you have to, when you are developing a policy, you have to consider these factors. Will be a priority area, and technical criteria, and also the feasibility requirement. Right. Now let's move on to, with that background, how policy is developed. We can basically develop the policy process into three broad stages, three stages. First step is called policy formation, just building up. That is, identify an area and start building up the foundation and that part. That is the building up. That is called formation. So identify area, take a decision, all that. And then technical people should come in, experts should come in and mixing all the ingredients and putting, coming out, what do you call that? Putting, now say you are making a dark blue, and there are several ingredients. You put all this together and mix it in good, correct proportion and mix them. What do you call that? Yeah, process. We call it formulation. Formulate. So policy also, you start building up, that is called formation. Then the next step is formulation. That's a technical job. Experts will get together and look at the ingredients and put everything in correct proportion and come up with the policy. That is the real difficult formulation part of it. Doing the policy. Now, can we put it into practice after these people build the policy? That is the next step. The ministry wants to develop a policy, accident and emergency policy. And expert group was put together and they consulted everybody and came up with the policy. Can you just, now okay, from 1st of March we are going to implement it. It has to be approved. That is the third stage in the policy process. We call it formalization. Formalization. Formation, formulation, formalization. Right. The start of identify area, that is formation, building up. Formation in building. Then formulation is mixing and really prepare the policy. After preparing it, it has to be approved. If it is a national policy, who will approve that? If it is a national policy which affects the whole country, the parliament, it has to go to the parliament. If it affects only the health ministry opening hours, that doesn't matter, other people are not affected. So the ministry can make the decision and approve, formalize, secretary has to approve that, and then send the circular. So that is the approval process. If it is in the institutional level, the head of the institution, the management board will decide and formulate the, formalize the policy. So 3 stages: the process where policy formation, the process where the demands of society are recognized by different social and power groups. That's identifying a need and starting. That is called formation. Then these are then transformed into political demand or advocated for adoption. That is the formation part. Make a decision. This needs to be done. the drug prices are high. They identified that and then decided that okay, we need to come up with a policy regarding the drug prices. Then the formulation. Second step is the formulation. Refers to shaping of our political demand into a set of values for social action. Earlier, it can't come with a political, because the minister identified that they want to do the drug price. But scientifically, a group of people, that is the formulation to analyze and see and develop, that is called formulation. The process for Bolsonaro implies the adoption of a social demand by particular author, analysis in terms of social interaction, enunciation require guidance for technical implementation, the final outcome that is the policy instrument you come up with the policy instrument. Then what is the third stage? Formation, formulation. What is the third? Formalization, approval, policy formalization. Is that part of the policy process which represents the policy statement with necessary or social arguments and approval, getting it approved. So then sometimes some people classify, this is the simplest classification, they break up other parts also. After formulation, approval, everything, is the implementation. After these three phases, once you get approved, you don't sit on the policy, no, you don't put it into a shelf and keep. You have to put it into practice. That is called the next phase, is the implementation, policy implementation. Okay. After you put that into practice, after some time you have to check. You have to monitor and evaluate what has happened after the policy. Have we improved things? That is called the policy evaluation and feedback. Okay, so three stages: formation, formulation, formalization. After that, you implement the policy. Then you evaluate the policy. If it not achieved, then you reformulate. You change the policy or come up with another. So it goes like a cycle. But it's basically the management cycle. What do we do in management? Three things: planning, implementation, evaluation. You start the cycle again. Policies also, you plan the policy, and we divide into three phases: formation, formulation, and formalization. That is the planning part. Then after planning, you implement, you put it in practice. Then you have to sometimes check it and see whether we have achieved that. Cycle goes on. So policy also same principle. So the policy has to be converted into the next stage now. You can't just policy will tell only the broad guidelines, only principles are here in the policy. You don't describe in the policy how to do everything detailed. So what did we do? And then after that, coming with the policy, it has to be converted into what? What is the next level? Yeah? Program. You have to convert that policy. To implement that, you have to come up with a program. So that is called broad programming. Under the policy, you develop a now policy says mothers and children given priority. So now to implement that policy, we need a program. That is the MCH program. So that is called broad programming, which translate policies into strategies and achieve the stated objectives. So you have to have policy says, okay, do this. But how to do it, the program will tell. Those are called strategies. Broad way of doing things. And then you develop the activities. Following this operational plan, then after that, those are the broad program planning. Right? So the Family Health Bureau developed a national program. Then who implements? The MOH. MOH should have an implementation plan. policy implementation through various steps of planning, management, and so on. So that's the flow: policy, program, then management, and then the operation. Then what is the meaning of policy reform? So if the policy is not achieving, when you evaluate, you have to either change the policy or stop the policy and come up with a new policy. That is called policy reform. Policy reform is a change in programs or practices. You change, you reform the policy, and accordingly you have to change the other things also. Policy reform is enacted by a government agency, but it may affect either public or private institutions. Then what is policy environment? All this happens in the environment. The policy environment or policy space is the arena in which a particular policy process takes place. Generally, the environment consists of institutional, individual actors, interest groups, as well as occasionally the citizenry. The actual policy environment differs from country to country and also according to the content of the policy under consideration. Some decision is made, it affects some people, that is also so they feel very significant. So environment, the economic environment, the social environment, the actors in the environment, all they are called the policy environment, where the policy is put into practice. Then another term we come across is policy makers and policy analysts. There are two groups. Makers are different groups who are the people who have the power. Analysts are much more educated, they have the expert knowledge, which they can analyze and tell. So major actors in the policy environment are generally corrected to as policy makers, people who make policies. Policy analysts are those who seek to assist the policy process, those who provide their input expertise to develop the policy process. Then another important thing is what is called the policy instrument. Now, how can we put that policy into practice? Now, take that head injury now. The injuries were going up and a lot of people were dying, motorcyclists were dying because of head injuries. And they introduced this policy to where all motorcyclists should wear helmets. We stop at that point. Can we see that everybody wears helmets? Policy is there. Policy is there. How do we put it into practice, that policy? Policy says only that. So, policy as it is cannot be implemented. You need what you need some instrument. Now, the policy says that motorcyclists should wear helmet. The policy is there. Now, how can we put it into practice? How can we put it into practice? How can we ensure that all motorcyclists wear the helmet when they ride the motorcycle? How do we see nobody going on the road? Yes, police, can they catch?
Yes, they are empowered.
Ah, right. What empowers them? Law.
No.
There is a law. Those laws are there. Motorcycle, they invented the law. Motorcycles. Earlier they could not tax because, and later there was issue also. They withdrew their policy also because the law has not changed. About this vice. the issue. So, we through that, people start, the police was like getting people covering the full face. But according to the law, it's not. So they had to work, they withdrew that and they changed the law and they started it. So the law is the instrument. If that law is not there, even the policy is there, policemen can't get one. How they have to be empowered? There must be enough law. That law will tell you if you do this, these are the punishments. This, or they have to be spelled. So that is an instrument. More common one to implement policies are laws, legislation. For every policy we don't have legislation. Some policies are implemented now. Suddenly government decides to increase the petrol fuel prices. How do they are they bringing in a law? How do they do that? How do they do that? Now, Parliament decide to okay for midnight today we are going to increase the fuel prices. The fuel market, fuel prices have changed, so they have a suit, they also. So so if you go to the shed tomorrow and you pay the whole fee, how does people know? What does the government do? Gazette. They gazette it. From midnight today, the taxes for potato imports are so they gazette. That is called the government order. Government orders are given through the gazette. So people have to follow that. That's like a law. People gazette gives orders. Or it can be circulars. So it applies only to a particular ministry. As I said, the Secretary Health can set a circular, changing a policy. So OPD, opening hours, if you want to take. Incentives also can be used as an instrument for, can you give an example? Now, in the late 1950s, the government made a decision to introduce a family planning program in the country, permanent sterilization. Policy decision was made, but people were not coming to get that with the LRT and the mastectomy. We try to bring down the fertility and improve the planning within the number of children. Policy was made, but people were not coming to get it done. So you can't reduce the fertility rates because not many people are getting sterilization. So what you cannot do? Gave an incentive, 500 rupees. Then people started doing it. That was an incentive to implement the policy. So that is an instrument. Policy instrument. So it need not be always the law or an order. You have to give an incentive. Government said people to come, give an order people to come and get sterilized. People did come. So you need to have to use the instrument of incentive. Similarly, you can use subsidies as a policy instrument. Anybody tell a example of a subsidy? The government uses a subsidy as a policy instrument. What are the subsidies? You know, government is giving various subsidies. What very common one? Porasana. You have to learn of people are doubting fertilizer. Why was that introduced? Yes, government made a policy decision. Agricultural department said that they have to increase the production, local production of agricultural products. But how to do it? People were using the traditional methods. And poor people were doing cultivation. So how to increase the yield? You have to use fertilizer. So, but still the farmers didn't use fertilizer because it's expensive. They could not buy. Then what did the government do? All the last few farmers gave them subsidy. They gave the fertilizer subsidy, 350 rupees each farmer. So they could buy at a very cheap price the fertilizer. Then farmers started using and the production increased. So that is also can be used as an instrument, one instrument. You see that's an example. Some various subsidies. Fertilizer subsidies is one example. So those are all called policy instruments. That is a policy advice per se it cannot be put into practice. You need some instrument to put into practice. Most commonly used instrument is the law. Or it can be an order, government gazette, circular, incentive, or a subsidy. You have examples for it. This is some examples of policy instruments. Legislation, banning of genetically modified food. This is the purpose of introducing that. Free health services. Purpose is to ensure equity. That's a policy instrument. Free health services. Policy says licensing. Private medical hospital has to be, earlier there was no registration. Why? To improve quality they brought in the private regulatory legal institutions act, and now they all have to register, and then that is to improve quality. Nursing Homes Act. Subsidies, incentives, that is mainly to improve the efficiency. Right, okay, we'll stop there. Okay. Back in 10 minutes. එදාට ඉන්ටර්නැෂනල් ප්‍රෙසිඩන්ට් ඇවිල්ලා බැක්කට් එක තියෙනවනේ. මම බෝඩ් මීටින් එකේ හිටියේ මට ගියේ ටිකට් එකක් දුන්නා. ගාවනේ ඉන්න කිව්වා බැක්කට් එක. ඒකට යනවා ඒ නිසා ඉන්නවා. Yeah, yeah. Yeah, was meeting with Tina and Okay, so far we discussed, defined what the policy is, and defined that set of interlinked principles to give a set of goals. Then we divided the policies into two categories. What are the two categories? Implicit and explicit. Explicit is where it is documented, other one is not documented. Then we divided policies into, depending on the level of the policy, into three types of policies. What are the three types of policies? National policies or political statements. Then secondly, program or managerial policies. Thirdly, operational policies. Then we learn what are the determinants, what determines a policy, what are the factors that lead to a policy. Yeah? Demand for services. If there some demand comes in, you need to have a policy. Secondly, socio-economic situation will determine the policies. Political pressure. What else? Yes, the national priorities. And finally, international agencies, their priorities. Those are the and other things. Then we learn the goals. What do we expect from a policy? Why we have a policy? What are the goals of a policy? Firstly, the most important, equity or fairness. Everybody treated equally. That's why we have policies. Then, your efficiency, adequate efficiency and technical efficiency. And then, community, people have to be satisfied, and then finally, policy. Right? Then we learned the policy process. First, we divided into three stages. Policy development process into three stages. The first one is formation, that is building up, identifying a problem, and deciding to have a policy. That is formation. Then formulation, mixing up and putting it in place, and then after that, get the approval. We call formalization. After formalization, what we do with the policy? You implement the policy, and then you evaluate the policy. Then we learned different terms and what is the policy environment, what is the policy makers, policy analysts, and policy instrument. What are the types of policy instruments we learned? Legislation, most commonly we got legislation, government orders, circulars, incentives, or there can be different. Instrument is something which is used to put into practice the policy. You can't just put a policy into practice. You need to have, sometimes people have developed policies, but they can't implement it because the law is not there in place. It also takes some time and the process, the law has to come. Right, so that is where we are, and then the managerial process of policy, how the policy development process and the implementation of the whole process is summarizing in 7 stages. Right? So first stage is called policy formulation or analysis. First you have to analyze about the issue and the situation. And then develop based on those the stages: formation, formulation, formalization. Right. After formalization, you have to decide on the strategies, that is program strategies. To implement that, you have to design a program, and strategies are broad way of it will not detail tell you what you are going to do, but very broad strategies. So development of strategies. Then based on those strategies, you have to develop a plan of action. How to put it in practice one by one, or you have to list out activities and time frame how we are going to put. So a policy document, good if it has a implementation plan also. Most of the policy document we have prepared a plan how to implement the policy. Otherwise, policy is developed and it is stacked up and nothing happens. So, and you have to identify at what point of time what are the next steps you have to do, who are responsible for those steps, and then you have to follow it up. It helps you to monitor and implement. So then development of the detailed program based on to implement the policy, and then you implement the programs, then you evaluate, and then you evaluate, and after evaluating you have to reprogram. If we are not achieving the policy objective, then you have to change the policy. So that is usually the policy process as a whole, total thing. Policy development we divide into 3 phases: formation, formulation, formalization. After that, the other things come in. So policy analysis is a learning process, to increase understanding. There are people, experts who analyze policies and come up with what is happening, what is we have given in that, and look at the political, social, managerial structures and process, all that they analyze, and will tell you whether it is workable or not. So why we analyze policies, the purpose of policy analysis, facilitate formulation of, if you analyze it properly and know what the background, everything, then you can develop a good policy. Some people policy decision made and then think they fail because they have not really understood the current situation. You have to really analyze what is it now, how it happens, all that, and then so it helps you, analysis helps you to come up with good policies, to operationalize the political statement into strategies and operational activities. So you have to analyze it and see, otherwise the minister or a politician will say, you have to do this, but you have to look into various technical aspects, other aspects and feasibility, all that, and tell what are the alternatives available, right? And then decide on the policy. So operationalize the political statement and strategies, and analysis helps you to really come up with a good policy. Identify policy issues to be addressed and improved upon by the adoption of a policy or a change in the existing policy. So policy analysis helps in looking at the situation, what are the things to be done, all that will help you in doing that. It involves a review of existing policy and its effects instead of unimplementation. First step in policy is doing a situation analysis. So the policy analysis will look at, okay, are there any policies at the moment for this issue? If not, then they have to come up with a receipt. So if the policies are there, then they will look at, okay, how far it has been there, how whether it has been implemented, and what are the results we have got. what are the new things that have changed, and we need to change the policy. So analysis will, first step is, and in the analysis to look at, do a situation analysis, doing a existing policy, looking at the existing policies and effects of those, what has happened so far. Then you have to look at all the factors, review of the situational factors which make the policy issue a problem. But look at the factors also for that issue. What are the things that are affecting? An assessment of likely consequences of alternative benefits first and scientific. And then you have to look at, okay, if you are going to change or come up with a policy, what are the different options that you have? Right? And then decide the best option which will give you the best results. That is technical efficiency and allocative efficiency and the cost benefit. So when they analyzed that they wanted Sri Lanka, so they wanted another international airport. So what are the options we had? One, locate one at Matala. One option. Build the new one. What is the other option? They came out. It costs a lot of money. One is to look at various options and decide what the set up a international airport. The other option. If you don't, the second airport, if you don't put it there, what is the most cost effective, you can get the benefit. Sri Lanka is a small country. You can get to any place within 5-6 hours. They said you go for a second tarmac airstrip in Kaduna. So you can, with the existing, with what less, lesser cost, you can come up with rather than visiting and disturbing the environment, all that. And now we see that would have been the feasible, so we have to really analyze and look at what strategy will give the best option. Further in future, it might be a viable. Right now, they used to show penny also because nothing was happening. Right? Again, for there, we were able to bring down the Chinese students. So that is important in looking at the options available. When we come up with the policy, that's why policy analysis helps you to look at those. And similarly, we had a problem with the port city. The government changed, another government came, they immediately stopped the project. What was the argument they wanted? Environment. They were saying that no proper environmental impact assessment has been done. It will affect the fish and all the environment. So therefore they are going to stop the project. Yes, stop the project. Then fresh environmental impact assessment was done. That showed that the steps they are going to take minimize the environmental impact of this thing. The benefits are much more compared to that. And then they started the project again. So the analysis will go into all these details, look at the various options available, what will happen and all that. An assessment of likely consequences or alternatives, benefits first. So it's very important. If the national policy is decided, we have to analyze and see. Some people straight away give up the policy without going into detail or detail to see the consequences. So other one is rationalist approach, where you just go by incremental. Right? It should be carried on an orderly fashion, starting with assessment of. So that is the rationalist approach. You look at the problem, analyze it, and see what is the current situation. Then identify the priority areas, what are the alternatives available for. That is the real process, that is called the rationalist approach. Step by step, you starting from where you are now where you want to go, what are the, how do we get there? There can be different options. So you look at all the options and see what if you take this option, then look at the benefits of each one and decide which is the most, that is the most rational way of doing this, coming into policy. Right? Obviously, I gave some examples, some things you are not rationally obeyed. Right? So that is the rationalism. Whole that the decision making should be carried out in an orderly fashion, starting with assessment of the problem. You start with the current situation. Really, you have to study the what is wrong. People do bring policies without looking at the current situation. Collection of data, synthesis leading to clear weighting. So you have to collect information, analyze, and see. Then select the objectives and actions and a system to evaluate the performance and outcome under this approach. Decision can be unbiased and based on knowledge and information. That is the best approach that we do when you are planning also, any other things also. This is the way. 4 questions in planning. Then we can apply to policy making also. First question you ask is, where are we now? This is these 4, if you know the 4 questions, that you can plan anything. This is the 4 questions any at the highest level national planning department also have to ask. So that is the rationalist approach also in policy making. Also first step is, where are we now? Without looking at the current situation. Now the pace was a lot of flights were cancelled and birds were coming and hitting the our remote seasons also. So proper assessment has not been done. Assessment of the problem. Where are we now? That is the first question. Then second question, you have to decide where you want to be. You just don't bring a policy without knowing where you want to go. So that is the second question. Where are we now? Where do we want to be? Then what is the third question comes to your mind? First question, where are we now? Right. Then, what is the next question come to your mind? That is called what we call the situation analysis, current situation. Even when you do something called some decisions in the PGIL, you first look at what is happening now. Right. Then, what is the next question you come to? Now you know very well what is the current situation. Next, where you want to go? That you have to decide. Where you want to go. Number 2. So you have to set the objectives and goals of the policy, what you are going to achieve. That without knowing that, you just plan the policy or plan anything. Policy is the highest level of planning. Other things are planning also the same thing. Now people have prepared plans, they have prepared the plan, but they don't know what they want to achieve. That also has to be thought about. Then what is the third question? How do we get there? How do we get there? That is the third question. The strategies, alternatives, and from that you select the strategies. Alternatives and strategies. Actions. Then, fourth question, you have to ask another question. When you go on a trip, what do? You are going from point A to point B. What do? You check as you go along where you are, whether you are on the correct direction. You are going to Galle, you check whether you pass Moratuwa, then you know you are on the correct road. If you see banana boat, you are leaving from Colombo, then you know you are going the opposite direction. Then what do? You turn back. So that also has to be planned. How you find out whether you are on the correct track. How, that is the question you ask is, how are we doing? How are we doing? That is the fourth question. Where are we now? Where we want to be? How do we get there? How are we doing? That is your monitoring and evaluation. That also has to be planned. In policies also must find out how you are going to see whether the policy is working or not. That is why monitoring and even the policy process we said monitoring and evaluation. After implementation, that should be. That also has to be planned when we are developing a policy. Some policies documents are there, there's no monitoring mechanism. That's why you need to have a plan to implement. Then you can use that and see whether you are doing the things correctly. So that is the rationalist approach. In policy planning also the same thing. Other planning also same principle. You had your planning and management module. No, right, okay. Remember these 4 questions, so you can do any planning. This is the basis. If you have a question, you answer these 4 questions. Write down these 4 questions on the side and write down what you are going to do these things. First step is where you are now, situation analysis. So you give technical terms, situation analysis, problem identification and prioritization, setting objectives and targets, constraint analysis of that means review obstacles and limitations, and writing down the plan. Those are the 5 steps in the planning process. I have summarized into 4. Easy to remember. Where are we now? Where do we want to be? How do we get there? How are we doing? Okay. So that is the rationalist approach. Other one is called the incrementalist approach. Incrementalist approach. Increment. Okay, you achieve something, you think, you add another, you change, and on top of that you increase that. Assume that the decision making is an interactive process of mutual adjustment, and that the way decision maker really make decisions is by looking at the general problem and adjust their responses of other actors. The decision making process is incremental. It does not start with objectives but start with what exists and where one can go. Right? So they decide, okay, next year they want to estimate how much trucks to be imported. They look at the current PS system and they just add, they don't do a real situation analysis, they just add 10%. Next year's estimate something. That is just incremental, and following year another 10%. That is called the incrementalist approach. That for certain things it's okay, but most of the times it's better to go for the rationalist approach, where you study the current situation and so policy, these are some examples of goal components of the policy. Okay? So the policy analysis, these are the main steps. First step is where are we now? The first question. Identifying, specifying the problem. Perception of discrepancy between existing state of where and the desired extent where, when, so that you must be clear what is the current situation. That is the first question. Current situation. When you are developing a policy also, that is the first step. You must describe the current situation. How much, without knowing how much of the problem is there, you cannot set a goal. How much you are going to reduce. So, and where the problem is, when and the repair. Then you identify what are the causes, why these issues are there, why this problem is there. If you are going to correct that, you must know what leads to that problem. Right. So you can use what is called a problem tree or a fishbone chart and analyze the problem, what are the effects because of this problem, what do we see, and what causes this problem. So you have to, your policy should have things to correct all these causes. Right. So effects, factors, causes of the problem and the root causes. So you do an analysis, underlying causes. Then where you want to be, set your policy objectives. Broadly, okay, how much you are going to improve. then you can check whether you are achieving that. If you don't have a goal or objective, then you cannot measure and see whether you are achieving that. So then, after setting that, then you have to see, to go somewhere, you might have 2-3 roads. Now you have the expressway. Are you going to go to goal, are you going to take this road, the old gold road, or are you going to take the expressway? To compare that, whether you have the toll fee and all that, the time available, all you compare all that, and you decide which road you are going to take. Similarly, when you are coming up with policies also, like the airport thing, we had another option. We could have even studied it carefully, could have gone for another option. So that is very important in the policy analysis. Identify the policy options, policy intervention that might be undertaken to address policy issues. There's not only one way to go somewhere, there can be 2, 3. So you have to look for all these things. And otherwise, that's why some people come up with innovative ideas, better ways. You have to think that and see to get the same result. We can have another approach. Then you have to decide before selecting which one, you have to have some criteria. Right? Selecting criteria for decision making. Now you have to make a decision which you have 3 options. Now without any criteria, if you go and select, that's fine. No, without any criteria, they selected, okay, we'll go for Vattala. You would have said, okay, what is the total cost to put it up there? What is the total cost to put it up at Katurai? What will be the benefit? What will be the impact on the environment? If there are adequate land at Katunayaka to put another track, or we need to go for some other place, or you can go for another alternative, whether you are going to put it up in Coronado. Now they decided that was a good move, and they have developed Jakarta Airport that facilitating we are getting a lot of tourists from India. Good market, we will have no people coming from there. So they are going to develop it now. The 2 airlines are doing it, and they are going to develop that. That could have been a better option. And already it's in business. They started 2-3 days a week. Now daily they have flights. Now they are going to increase the number of flights per day also. So I see. So so you have to select have those criteria before deciding. So the cost, the benefit, the feasibility, all those have to be looked into. The impact on the environment, all that, and then you decide. Then you have a table, and you put marks for each one, each option, and you totally. That is the prioritization or selection process adapted at even the highest level anywhere in the world. You must have criteria. That's why that's why the problem is, that's why our parliament, we don't have any criteria to select the candidates to the parliament. That's why we are in the West. Now people are realizing that now people are coming in, we get 225 people, must be good people, no criteria, no educational level. So basically everybody can become an MP. So like that, so you need to have some criteria for decision making. Now we are making decisions who will govern the country without any criteria for selecting the people who decide on behalf. Policy outcomes can be judged in terms of a number of factors such as problem magnitude, political acceptability, technical soundness, congruency with present legislation. So we have to look at all those aspects in deciding, in selecting the criteria, feasibility, cost, benefit, all that. So you select the criteria, important one, then put a table and mark it out, and you select the best. And then you choosing from among the options. So after applying those criteria, you select the best option. It's not only one criteria. You don't, this is one, they decided only one criterion. President's electorate, they wanted to put it up, that's only criteria. They looked into other, the feasibility and impact on the environment, and then they would have come to a better decision. Maybe that could be, but it would have been a solid decision after assessing all those criteria. Decision has to be taken like that. Choosing from the option based on assessment according to set criteria and the constraints. You have to look at the constraints also. What are the bottlenecks that we have? Select the most feasible option. Then you select, after applying the criteria, select the best option. Select those options which are most likely to be accepted and implemented. That is the other thing. And then selected option become proposed to go on new policy. Then you select and go for that policy. Then next step is you once you decide, you develop the policy, draft the policy statement. What are the things should be in the policy statement? The policy statement embodies new policies or policy changes. If you are changing a policy, you are coming up with a new policy. So the contents of policy statement should include health development goals and objectives. We are developing a health policy. What you have to work within the framework of the overall health development. So it should be in terms of like that, objective, present situation of the health development and its problems, previous policies and initiatives, policies that they relate to the policy objectives. So you have to, again the same thing, where are we now, where we want to be, how to be there, we have to consider all. Right. So when you are doing the policy process, you can use various tools for various steps in the policy planning process. What is the first thing you do when you are planning something? Where are we now? What do you call that? Situation analysis. To do a situation analysis, you need some tools. Do you know any tools to do situation analysis? You have to collect data and analyze data. For those things you need, so those are called context assessment tools. There are tools to find out where we are now. To help that process, there are simple tools which you have already used for your work, your institution, to find out. You can use those scientific research methodology. Also we use this. How do you find out the current situation? What is the most common one we do? Survey. You do a survey. That is the commonest way, tool. There are different types of surveys. You can do an interview survey, questionnaire survey, and that also the different telephone survey. So various types of survey to consult a large number of people to get ideas about the current situation. Then what are other things? You can do key informant surveys. You can do focus groups discussion. You collect a group of people, some knowledgeable people about the issue, and have a discussion with them. That will give you some ideas about the current situation. Now we are going to do a project or do a policy for a village. You don't have to go to each and every person and ask. It's impossible. So what you do, you collect a group of community leaders, the principal, the priest, and the Grama Nildari, like that, some key people from the village, and have a discussion with them. So there are various tools to do assessment. I will list you. And there are scientific ones, research tools are also there. Various survey methods and things like that. Then you need to have some communication tools. You have to communicate with the others who are affected by this and also get their views. So you have to communicate. So there must be some tools which help you to communicate with others. Then there must be tools after developing the policy. You have to implement. You have to get the support of others. So you have to influence the people. There are tools to do that also. Advocacy tools to advocate that. So I have summarized all that in this slide. I said these are communication tools. These are the context as what we discussed. Rapid framework for analysis. There is a problem tree analysis, stakeholder analysis, mostly. These are SWOT analysis. You know, for institutions, you do what is called a SWOT. Strengths, opportunities, weaknesses of militaries and tendencies, right? So for tendencies, there are various, these are some of the tools that you do to do a situation analysis, to find out where we are now. For policies also you can apply. Then there are research tools, like various studies, focus groups. Those are research tools that people key informant intervention. Then these are some of the communication tools. Organizational readiness, market segmentation, better mapping the product life for marketing approach, product mix. These are private sector people are very fond of these. They are using these in communication too. Rights of what is happening with the rights of I told the students also.
Yeah, he spoke to me.
Right, okay. Fix that up. Yeah, we go and want to do that.
I know the place though.
Yeah, that's a
Just
definitely.
really
Policy influence tools, lobbying and policy papers, campaigns, all that. So there are different types of tools for in the policy process and different. Now this is an important slide where I discuss the principles as we go along. That is that we have different levels. At the national level, we have what is called the national health policy. That should have a vision, policy direction, all that. That's at the top. Now, you cannot use that. You have to put it into implement. To implement that, you need to have a strategic plan, the long-term plan. To put that into, you have to develop a long-term plan to put the policy into practice. So that is the national, we have what is called the health master plan. That is long term. For 10 years they have prepared the health master plan. I will show you the document later on. So that will give the strategic objectives, health system investment program, is broad, very broadly what you are going to do. Then under that you have various strategies. There are to achieve this broad overall health strategy, we have different strategies. Like here you have the malaria strategy, child health strategy, reproductive health strategy, EPI strategy, NCD, all this will go into developing this strategy. Those are the priority areas and other strategies. So each program will have their own strategic plan that will lead to this. And then for this, you have to develop a expenditure framework for the next 5 to 10 years. That's how the government does. The Ministry of Finance prepare what is called the strategic plan, which will give the cost for the next 5 to 10 years. That is a budget or a long-term budget framework. Then so you, based on that, you develop other this thing, and based on the expenditure framework, you develop annual budget, operational plan. Now each district has to prepare what they are going to do next year and send to the Ministry of Finance. They allocate money according to that. But that should be based on the long-term plan, strategic plan. Within that, what you are going to do next year. And then the second year, third year, like that. So those are for the, some people comprise a medium-term plan. That is strategic long-term plan. Then you have a medium-term plan, usually about 3 to 5 years. Long-term is about 5 to 10 years. So medium-term plan you have for thing, and then based on that, you for every year you prepare an annual, what is called the annual plan or a short-term plan. That is, this shows that. So now see policy getting into more action, this thing, and the budgets are prepared. This stands for National Health Policy and Strategic Plan. National Health Policy and Strategic Plan. That's the broad way. So that is based on policy, and also starting point is the policy. You have to have the policies. Then based on that only you do develop your strategies. So this summarizes the whole thing. This is again same thing, schematic review. So we have what is called the National Health Policy. Then we have the National Health Strategic Plan, and then the priority areas, HRH, National Essential Drugs Policy. So there are this is the overall national health policy. Then for various subjects, areas, we have separate policies. Now, drug policy. Within the health policy, we have for that subject, there's a detailed one about drug policy. So like that, then disease-specific strategies. So we have policies for malaria control, TB control, and based on that, we have a strategic plan for malaria control, TB control. Then you have medium-term plan, right? That is for 5 to 10 years. Then for 3 years, you prepare a medium-term plan based on the long-term plan. And then, so medium-term plan, and based for each one, you prepare a expenditure framework also. For the next 3 years, how much money we will need, that we have to plan. And then, third level is operational, district operational plan. They prepare an annual plan. Based on the 3 years, they know for the next 3 years. So some activities you cannot finish in 1 year. So they know for this year how much we need, next year how much we need. So annually they prepare that's more operational and operational, like based on the policies and differently. So this is how policies are converted into action. Right, so it's a continuous thing. This is the policy dialogue, right? You have to consult the people. First is, we will learn later about in the afternoon, stakeholder analysis. So people who are, you have to consult all the people who are affected by the policy. Especially people who are negatively affected. They are the people who will protest. Right? Therefore, you have to consult, population consultation. Right. Then, so you have to get on board all the people. That's why some policies have problems. Now, TikTok. Still, nobody knows what is there. So people are protesting. If they consulted, they made people aware, this is what is happening, then people are explain to them why this thing. Without telling people, nobody knows what is there, so people protest. So the policy, the agreement was not yet signed, for how many years. So that is why it is important that you consult people. And then do a situation analysis, where we are now. Do a good situation analysis. Then after you do the situation analysis, you can't solve all the problems. Therefore, you have to select what is called priority setting. Next, you do priority setting. You select the most important things. You can't do everything. Therefore, you select the priority areas. That's why you need to have some criteria, and based on that, you set the priorities. Then, for the selected priorities, you do strategic plan, long term, to achieve that. Then, based on the strategic plan, you do operational plan annually. And then, after plan, you have to costing. You have to cost how much money. So you have to prepare a budget also as a part of the plan. And then you prepare you look at the cost, and then you prepare the budget. And then monitoring and evaluation. So it's the same thing, the policy also, like anything, planning cycle, planning, implementation, evaluation. All have to be planned. So remember this. And you see every stage you consult all the people. These are different, I'll show you in the next slide. Different groups, you can classify these stakeholders into groups. Now, we have to involve them from beginning to end. That's why ICTA, you see, they never, after when they were going to sign the agreement only, they tell people they are going to sign it, people say no, we don't know what is there. They are scared, they don't know what will happen. So that's why it is important when you are doing policies as consult as much as possible. Okay. Now that's the introductory part of it. Let's look at some of the national policies. When was have anybody seen the national health policy? No, I will show you. When was the policy developed? Sri Lanka health policy. 5 years, 10 years, 100 years, 200 years. Before that, no policies. I will show in the afternoon, historically, policies have been there from the king's time. I will show you pictures in the afternoon. Health policy at that time. Formally, the policies were started here. First one was developed in the recent past, was in '92. The President appointed a task force for development of the national health policy. So the task force, which was chaired by the former professor of community medicine, Professor Alphonse, and all stakeholders were involved in that, came up with a beautiful policy. Most of the current things are based on that policy. But they came up with the task force report, a big document, and some big versions, not commonly. But in '96 only, really a policy statement was prepared. That was a big document. That was a report task force, not a policy document, policy statement. So '96 we came up with, from that, we came up with a policy statement. So a 5-page document. Very broad things were spelled out in that, I will show that also. So a policy statement. At the highest level you don't have books of policy. So we came up with national level policy to spell out what is the current situation, what are the priorities, what are the policy goals, how we are going, what are the strategies. That's all in the policy document that you need to have. So that policy statement or policy document, '96 was the one that was there on the policy website also. And then '97 also the new president also wanted to have another task force and develop a policy. So I will talk later in the afternoon the differences between why the one was successful, the other one was not successful. So the factor already will be some of the factors I will share with you. So those are, that is for the '92 the President Task Force report. '96 we came up with a policy statement, and '97 report. You will not find this document. That time photocopying was not that popular, so the cyclostyle, the policy was the development part went through. Again the task force was not properly populated. All stakeholders were not there. So when after doing the work, they didn't involve all the stakeholders from the beginning. So they invited stakeholders to the parliament to get it endorsed. So when they came to me, some trade unions said, okay, this is the first time we are seeing that, we need to discuss further. We can't approve that. Certain things they have agreed, but certain things they said, no, we need to. So that's the end of the policy. That document was not printed even after. But some of the important decisions were agreed upon, they were followed up. One policy decision came up on that was to develop one hospital in each district as a district general hospital. That was one of the recommendations from the '97 task force, which was implemented. The ministry set up a policy implementation unit, appointed the former public administration secretary, Mr. Silva, as the head of the unit, And the president every 3 months was reviewing, meeting with them and reviewing the progress. And now each district we have a good general hospital. That's one of the things. So some things came out of that, and there's no document I have to see now. Then when a new minister came in 2001, he came up, his policy was just 18-point program. Just 18 points. We will control Delhi like that for few statements. That was not long lasted. But the formal this thing was in 2003 we started developing a good policy document based on a strategic approach, looking at 10 years from 2000. Really, when we finished it, it was 2007. So 2007 to 2016, first health master plan was developed, a strategic document covering 10 years. And what we started was, we started in 2003 strategic framework for health development. Based on that, a master plan was developed. So the Japanese government and also the World Bank both wanted to give money to develop a master plan. So we said we used the World Bank money and developed the strategic framework. And a lot of consultative meetings when everybody went to the district, communities and this thing, and developed the full overall framework for the policy. And then we got the JICA grant from Japan, and they funded it and provided resources and came up with a very good health master plan. That was we developed in 2004. We got the tsunami, so it got delayed because of the tsunami work, and then there were further discussions with the other trade unions and things, and then everybody agreed. And 2007 we launched to 2016. Then by the internet, the national saying that they have thing. And something happened before this. Policy decisions were taken in the 87. What was the policy we had to implement? But there was a national policy. There was no health policy as such. What was the national policy change, policy reform, which affected the whole country? 1987. What was the national policy decision, government policy which changed the whole country, all the sectors? No, free services were introduced in the 1950s. So the major policy change in the country, 87. Different knowledge. The 13th Amendment. What is the 13th Amendment? People are talking about the articles. What is the 13th Amendment? The 13th Amendment. What did we do? Come. This is just bad on the street will tell you. Don't get this answer. Everybody talks about the 13th Amendment, very famous. Decentralization. The power from the central government given to the provinces. Provincial councils were set up. Provincial councils were set up. So other ministry sectors are also asked to follow that. Health also had to change and decentralize. Central government was running everything. Now they handed over all the small hospitals and the preventive services to the provinces. That's a major policy reform. And so that's 87. Right. So then there are other policies, like one of the policies very well done long ago in the 80s. Population and reproductive health policy, maternal and child health policy. These are some of the good policies. Then medicinal drugs policy, that we thought we changed 2 years ago. National blood policy. So priority area, mental health policy. National policy on hospital quality and safety, that also came recently. National nutrition policy. adolescent health policies. So many. There's now large number of policies. All I show you. They have compiled all to one document. I give you the whole document, all the policies, and I will go through this slide later on. In policy development, or when you are trying to develop a policy, these are very important factors to be considered. One is there must be a political commitment. If you want, the politicians are not convinced and this thing, so therefore we must get their commitment before we are going for a policy. Important thing is that. So even for your institutional policy, you must get the leadership commitment. If you want to change something, first you must, without their support you can't go. So they are the people ultimately who make the decision, who will approve the policy. Therefore you must get their commitment. They must be committed, not just say okay. They must be committed that they will help to do that. Policy formula, then you have to set up a committee or a task force to oversee the whole process. This is very important. You have to select the chairman very carefully. You have to select a champion who is acceptable by everybody at service and represent all the stakeholders. 92 task force had that composition. They selected Professor from University, Professor Fonseca, who is the conductor of the Sri Lanka Orchestra, around the orchestra. He was a musician also, so he was selected as and then all the stakeholders were invited and the representatives were invited, all the trade union, the private sector, Ayurveda sector, name everything. Everybody was represented, and academics, service providers, all that were the NGOs, civil society, all were. So that's very important that you have a steering committee or a task force to carry through the process. Other few people getting together, some policies, few people get together, try to do that. Then you have to have a core group, or you can call it a technical committee or a smaller group. Right? Core group of people who will do day-to-day work and work develop, and only for decision making you put into the task force or the steering committee. They can't be, they are senior people, secretaries and developers. So they can't be doing day-to-day work, they have their work. So, but they will meet every 3 months or so, and they will make the decisions and give you direction. So there must be a smaller group of experts and the people involved in that, working day to day and doing all the technical work of the policy. And there must be, it should be anchored to a focal point. It must be anchored. Now that reproductive health and population policy was based on the population division. There was earlier a division in the family health bureau called the population. There was a director for population. So he carried through the whole process, it was anchored there, and follow-up was also done, monitoring was also done by the chief. Some policies are developed, there's nobody, it's not anchored somewhere. So it's very important that it is based on the correct place, the focal point. Then there must be a time frame. Now, our Sri Lanka, it takes several years sometimes for some policy. What is the ideal time you should develop a policy? Now, some policies take years, several years. What is the disadvantage if you take several years? By the time you finish the policy, things would have changed. Then you have to do another situation. So therefore, taking a long time is not. So what is the ideal time? 5 years? 5 years, many things I would have changed. Policy, biggest policy you should be able to finish within about 8 months. 6 to 8 months is the time frame they give. Small policies you can finish within 2 months. But really big policy should be finished because by that time, where things would have after 8 months, it would have changed the situation. complete renewal, you have to come change your policy. So ideally, it's also you should not take too long. You have to be finished yet within a reasonable time. So first step, I said, where are you now? Do a thorough situation analysis. Some people develop policy without looking at where you are, current situation. So your policies will not apply because you don't know the current situation. So that you have to do, look at the existing documents, interview with key people, like various tools you can use, and you ask some experts to provide position papers. Different subjects you write about now national health policy, 92 tasks, so they ask for position paper. Expert in human resources, we ask him to write about the human resources in health in the country situation. He analyzed and similarly financial expert was given asked to write about. Like that, those are called position paper. So you analyze all those and get the correct picture of the current situation. Then the importance of getting all the stakeholders involved. We'll after look at how to do that with the stakeholders. Then you have to look at the implementation factors. When you are going to put that into operation, whether the infrastructure, funds, everything is there. Otherwise, you will come up with a policy, but you cannot implement the policy because no funds have been identified. It has happened to many policies. And then you have to publish it and widely circulate. 97 report, you can't find any copy. 92 was published, summary version also published, and widely circulated. Right. Okay. Any questions? Okay, so we discuss what is a policy, different types of policies, what is the first classification, explicit and implicit, then we classify it according to the level of policy, natural policies, program or managing the policies, operations policies. Then we discuss about the determinants of policies, factors which determine policies, demand, then socio-economic factors, political, yeah, international priorities, national priorities, and others. Then we discussed about 5 goals of a policy. What do we expect from a policy? Equity or fairness, allocative and technical efficiency, quality, patient satisfaction. Then we discuss about the policy process, starting with formation, formulation, formalization. Then after that what we do, we will implement the policy. Evaluate the policy. And we learn with different definitions. Then we learn what is a policy instrument, which is very important. What are the types of policy instruments we have? Commonly used in legislation. Yeah, orders, government orders, circulars, incentives, subsidies. Then we learned about policy analysis. 2 approaches, the rationalist approach. Remember those 2 questions, where are we now, where are we going to be? The one is the incremental approach. Right. Then we learned about different policies and then the different types of policies and how the policy is converted into programs and the long-term strategic plans and then operational plans and annual planning is done. Right. And then we discuss some factors in the policy process. Okay, we'll break for lunch and then come back and what are the government policies and how others are aligned with that, and the global policies, how it relates to, so you will get a complete picture. Right? So we are looking at how for this century, strategizing national health in the 21st century, how what we have done, what are the policies to go forward in this century. What are the linkages to the global policies? ඉස්සෙල්ලගේ දෙවෙනි කොටස රෙකෝඩ් වෙලා නැති වෙයි. Right, so we are in this section more policy planning and development, looking at global development, national development. Within that, how policy are placed and look at the big picture. So under that, we will be looking at strategizing the national health in the 21st century. Sri Lanka, how we are placed, how we are looking at this century, how we are going forward, policies decided. And then linkages with the global policies and between the other policies, how the linkages, how important and how they are linked with the other policies. Then the changing context, we are going through some changes, new developments are happening. So what are those developments and how we are adapting to policies to this thing, and then the national policy direction, what are the current policy direction given, and also the Department of National Planning and its role. How in the country, who are the people who are doing the national policies in the country, the department. So how are we strategizing the national health to the 21st century? So there must be a policy dialogue, continuing policy dialogue. Functional health systems that deliver high quality services to the population are the main priority for governments. So governments are concerned, most of the governments are concerned about it, because health is wealth, health is the key to other development work. So it is the center hub of development is health. A healthy nation will lead to better outcomes. Achieving this requires permanent, well-structured, dynamic processes which are true consensus between the demand and supply of services, as well as between the governments, services providers and the population. So all these have to be linked. A solid evidence-informed policy dialogue is the only real way to achieve this in the 21st century. So all these parties have to come with the beneficiaries, the people, the decision makers and providers. All have to come together and work together to achieve all goals. So, what are the global policies right now in place with regard to development? What is the main policy, global policy that countries, the UN has brought in all the countries to comply and work towards a global policy? That is the organization, WHO. This is broader than WHO. WHO is a specialized agency of the UN. We will be talking about WHO next day. What is the global picture? What is the global standards policies are made by the United Nations usually, which have almost 200 countries and members. So what have they said for the member countries? What is the policy they have put? And the countries have signed up and following those policies. Yeah, sustainable development goals have been set. That the global policy identified. How many you know? Earlier in 2000, year 2000, we said the global. We said the Millennium Development Goals. There were 8 Millennium Development Goals set, and then we followed up, and now by 2015. Then 2016 they set these sustainable development goals, and the countries, member countries signed, and all countries are now following this to achieve this. That's a global policy that work towards the sustainable development. How many are there? Anybody knows? 17. There are 17 goals, sustainable development goals are there. So we should know a little bit about that. That's a global scenario. And then in terms of that, the world is looking at strengthening health systems, strengthening the old systems so that you will achieve these things. And another key area all the countries are working is what is called the universal health coverage. Everybody, everywhere is delivered, is accessible to health care. That is, so those are the context that we are currently, that current situation. We have in front of us 17 sustainable development goals to be achieved in which year? 2030. Right, 15 years from 2016 to 2030. And strengthening health systems and the universal health coverage. What do you mean by strategizing? Strategy. The word strategy came from the military, the army. Right? So when they are fighting a war, the people come and they have a map or a model of the area. Then they say, okay, the enemy is there, we'll send one team this way, we'll send another team this way, and we will get the Air Force to give their cover. By that, those are the broad way of achieving the goal. They want military strategy. They plan out strategies. The broad way of how we are going to do it. Very strategy means broad way of it. It will not give you details, not the activity level. It's a broad ways, directions that it's called strategy. So strategizing means designing plans and policies to achieve a particular goal related to the health of a nation. That is giving broad goals. This is the way direction we are going. It's like if you want to go to the Karnataka hospital, you say we are going southern province. That is broadly telling you. Not exactly telling, but the broad way we are going to. You will go that way without going to the north or east somewhere else. So broad direction over the years, usually about 10-year horizon. That is what we are strategizing. Designing plans and policies to achieve a particular related to the nation of the long term for the next 10 years. This is what we are going to achieve. Right. So that is strategizing. And then the second one I put in the first slide was that universal health coverage. It summarizes what you mean by universal health coverage. It's not just accessibility. People will be able to physical, not only the physical accessibility. Universal health coverage means more than just physical going to a health facility. Sri Lanka, we have almost every 3 kilometers, anywhere in the country you can get to a health facility. So that the accessibility is quite good. In some countries, Nepal and all, you have to travel days to get to a health facility. Imagine the plight of the people in those areas. So that was original thinking, accessibility. Accessibility is not enough. In universal health coverage, there are 3 dimensions. What are those 3 dimensions? It's like a cube. Right. First is this horizontal axis, population. Who is covered? What percent? This is the total population. With this much, then we are covered only up to this point, about 70%. You have 30% we have not covered. So Sri Lanka is very much better. We are almost nearing accessibility wise. The population covered, we have covered any remote area, there's some health facility. Then not only a facility, then other one is this axis, services. Which services are covered? Now we have teaching hospital. Teaching hospital provide all specialties, subspecialties. How much is accessible for people in all the provinces don't have accessibility in their province. That's why they made a policy decision. Where there are no teaching hospitals, those provinces, the biggest hospital will be developed to a provincial hospital. The only difference is that they are not doing any teaching function, but the services are same as a teaching hospital. Subspecialties are also developed. So then we are fair that all the people in all the provinces will be covered with tertiary care. So that's all. Then each district to have one district general hospital. So the coverage of the country, all districts now have a district general hospital. Services covered. Then you have the base hospital, you don't have all the specialties, some specialties. Then as you come down, specialist services are not available in the divisional hospitals. Right? So, and also the type of services that, so it will then, that also how far that we have covered the population. In the third dimension is the cost. This is the amount of funds, this axis, spent by the government. This is the total, is this whole axis, right? Total expenditure on health. Who spends for health of the people in the country? Government spends because free services are provided. Then balance. Who spends this amount of money? Government spends only this, almost about 50%. Out-of-pocket expenses. People pay for the health services. This is the government is spending for the health services. The balance, 50%, almost 50% is spent by the people. Either they, rich people, they can afford, they go and pay and get services. That's from their pocket they pay. Even the people who are using these services, for some things they have to buy some drugs, some investigation had to be done in the right. That is also out of pocket. Right? So that is the total. So the universal coverage, we have to cover as much as possible the people. Reduce cost sharing and fees. We have to cut down. It is going up, then means the people who are using this also have to pocket out some money for that. We have to cut that down. Sometimes some people, because of the expenses, just because if they get some illnesses, they go bankrupt, they don't, they go into poverty. They manage their this because of the illness, they or sell their property, everything, and then they go into poverty. That is called catastrophic expenditure. Catastrophic expenditure. You will learn in the economics module. They which pushes the expenditure, which pushes them into poverty. They are at the word, they are not poverty, they are above the poverty level. How do you define the poverty? What is the cutoff point? How will you find a person is poor or not? Yes, earlier it was $1. Those who have an income of $1 a day, now they have raised this thing, $2. Those who are below, those who have an income of $2 per day, right, are considered poor. Some people use both, less than 1, less than 2. So, sometimes because of certain illnesses, they get pushed into that, their income, their expenditure goes up and their income, they come below the poverty. So that is called catastrophic expenditure because unexpected, because of delay, they are pushed to poverty. So you have to cut down, that is why they have to that is called risk protection. People have to be protected. That's why these various schemes are coming in. Insurance schemes are put in place to protect people getting into poverty. So this is a framework for universal health coverage as a part of sustainable development goals. What we expect from sustainable development goals, right? Global public health security and resilient societies. Right? That is very evident these days. Global public health security with this coronavirus, security is threatened now globally. Equitable health outcomes and well-being. Not all the people in the world are enjoying the same level of health. Some countries level is high, some are poor. Not between countries, some within the country also there are differences. So equitable health outcomes. The end result should be whether you are rich or poor, the outcome should be clearly research has shown that sometimes poor people are suffering more from certain diseases. Poor people are dying because of the illness more than the rich people. So therefore the outcome is not equitable. Whether you are rich or poor, your outcome should be the same. So and well-being, and then inclusive economic growth and health sector jobs also important as an outcome. Inclusive economic development. If we contribute, health should contribute to economic development, and economically also we should develop. So these are the results or the outcomes, and to achieve that, we have the goal of having universal health coverage. That is one of the goals in the health goal, universal health coverage. All people and communities receive the quality of health services they need without financial harm. They are protected from catastrophic expense. How to achieve that? You have to strengthen the health system. Strengthen the health system. Next day we will discuss what is the health system and what is it in Sri Lanka and compare with some other countries. Right. And the factors that determine the health. So this is a big framework to achieving the health. So, and it has to be, as in the previous presentation I showed you, everybody, all stakeholders should get involved. The government policy plays an important part. Private sector has to get involved. Lobbies, partners, international institutional reforms, clients and patients, NGOs, civil societies, professional associations, political parties, programs, decentralization, elections, all these are entitled the whole of government and the whole of society approach to policy dialogue. Everybody should get involved. That's why some policies have problems. People are protesting and all that because they were not involved. They are kept in the dark, they don't know. So it's important that when you are doing policy work, involving all the stakeholders. And this is the structuring of the policy dialogue. There are three critical papers. One party is the state. State led by the politicians and the policymakers. Then we have the people receiving the services, the clients and the citizens. Then we have the providers, who all are belonging to this category. The private sector, public sector, providers, the people who provide the services. So it's like a triangle, and we have to work closely with the other stakeholders. The government has to work closely with the political parties, non-governmental organizations, other partners. Government policy also plays an important role. And then the providers, the private sector, professional associations, NGOs. So, and then the clients, the civil society, and the patients. They provide the services. The clients power, technical input and oversight. They are not satisfied. Like directive, like the information reporting and responsiveness. How does the state address the needs of the people? It is called responsiveness. Non-health factors that affect this satisfaction of these people. Right. So the policy dialogue, you have to involve all the stakeholders. We will learn about stakeholders. So these are the 17 sustainable development goals. Right. One is directly health. Which one? Goal number? Which one is health? Number 3. Goal number 3 is health. But others are all, some are directly related to health. For example, environment. Clean water and sanitation, directly related to health. That's goal. Right. Some of our achievement in health is not due to our work, but due to our good housing program. People now those dysentery diarrhea have now gone. It's in the past. 20, 30 years ago, we had a large number of housing schemes have come. Toilet facilities have improved. So it's not the health intervention; it's other interventions have contributed to improved health. So some are remotely, all are related to health. I will show you another slide. Yeah, this is the slide. So health is at the center of everything. Ensure healthy lives and promote well-being for all at well-being all at all ages. That is the health goal. Other 16 are around that. Now this one shows the linkages. Right. How this little word about the sustainable development, good for your general knowledge also. It came into, started in first of we had Millennium Development Goals up to 2015. End of 2015, 2000 we set the Millennium Development Goals, 8 goals, and we completed that and we achieved most of those as Sri Lanka. Those Millennium Development. We were ahead of those goals. Even sustainable development, already we have achieved some of the goals. So they started these sustainable development goals in 1st January, and in Sri Lanka we have I don't know whether the current government is but now it must be part of the previous government had a separate ministry. They created a separate ministry dedicated for it is called Ministry of Sustainable Development. There were 2 other subjects also along with them. So they had a ministry to see that we are going towards the sustainable development goals. Now this must be part of another, we cut out the number of ministries, so it must be still there, but it will be part of another ministry. Then they appointed a parliamentary select committee to monitor, work closely with the ministry and see that we are planning and achieving those sustainable development. Then they passed an act of parliament. A policy decision was made and the act of parliament was enacted in 2017, which is called the Sustainable Development Act number 19 of 2017. They started implementing that in 2017. So this is a global policy. This is what we have done to implement the global policy. Then they established what is called the Sustainable Development Council. Under the act, act spells out that there must be a council who will govern the affairs about the development, sustainable development. So these are the achievements that in Sri Lanka what we did to ensure that we achieve the sustainable development goals. Movement started with the global movement in 1st January. We have a ministry, select committee, and act of parliament, and a council was established which monitors the. Right, this slide shows you the relationships to the health goal. Health goal, and then there are 16 other goals. Now, promote healthy, health goal is, goal number 3 is promote healthy lives and well-being at all ages for all. That is the goal, very broad statement. And there are 6 other goals which are directly related directly affect the health. Those are called risk factors for health. Food security and nutrition is one goal. Ensure food security and because it directly affects health. If your food production is less, people become malnourished. Water and sanitation directly affects the health. Energy directly affects it. Cities, urbanization directly affects health. Climate change directly affects health. Peaceful and inclusive society directly affects health. So these 6 of the 17 goals directly affects health. Then there are 8. These 8 indirectly affect on health. Those are determinants of health. Poverty. Poverty doesn't directly affect, but poverty to other things. Fewer people become more sick. People are suffering from people like that. Their nutrition becomes poor like that. So many things. Indirectly it affects health. Education. Similar. Gender equality. Economic growth and employment. Infrastructure, industry. Right? They don't directly but indirectly affects consumption and production, oceans, seas and marine sources, ecosystems, all affect this thing. Then one is cutting across everything, equity, and 71 is means of implementation. That is also one goal. See that this is sustainable development goals are implemented in the country. So this shows the linkage or the relationship with the health goal and the other 16 goals. Some are directly affecting the health goal, others are indirectly affecting. So therefore very important that we health sector alone cannot achieve improvement of health. We have to work very closely with the other sectors. In fact, a researcher called Matthew Ward, he has said, how much do you think the health sector people, we all, contribute to the health of the people out of 100%? Say, if there's 100% factors affecting health of the people, how much the health sector alone, we who are working in the health, contributes to the health of the people? Other things are contributed by education, food, all that, agriculture, they also contribute to it. If you add up all that, what percentage of the contribution to improving health is the health sector? How much do you think? What you and I are doing? How much it affects the health of our people? Percentage out of 100. Including the post-graduate student community. How much it contributes? No, what percentage? Yes, how much? 5%, 20%, 50%, 80%. Health sector contribution. Yes, analyzed. You are, yes. Health sector contribution to improvement of health of the people.
Yes, sir.
Not 50%.
Or 50% you think that is contributed to any other places? He thinks other sectors contribute only 50%. Health people, health sector, our hospitals, our preventive services contribute, he says 50% to the improvement of health. What do you think? 25%. Any other guesses? You will not believe. He says, Lasiwar says, only 10% happening. So we are outing and this thing that we are ready to get the other sectors. So that's why we have to now move out of our sector, get the other people to work. Now social services ministry gets only a 100 million to their budget. If we spend more on the social services, it will contribute to health. Now people are aging, social services can do a lot. They are only preventing and treating diseases. So the housing ministry that have already contributed, we can see the diarrhea diseases are now gone. We don't hear those things. Those days, cholera, dysentery, diarrhea, rampant. We had to promote fever, all that. Now nobody bothered about it. Why? Is it the health people? No, it is the health people. The housing, the Ministry of Housing and this thing has contributed. The road network and so all ended up. The other sectors. So that's why now they have a initiative called Health in All Policies. Health in All Policies. They say all policies are health policies. If you are constructing an expressway, you have to see the health impact of that. Now, you are concerned about the environment. When you are doing some projects, big projects, they do environmental impact assessment. Nobody does. In other countries, they do, developed countries, they do a health impact assessment. Really, that's what the port city also had that problem. They have not looked at that. You have to look at the health impact of any project, and then so they do that. You have to work with other sectors and see that they do what the policies they are helpful to the conducive to the health of the people. Right. So in Australia, in Victoria State, they have started this movement. All policies have to get approval from the health sector before finalizing. Because they will develop the policy and put it, there might be health implications. Unless you are concerned about that and take corrective action to safeguard the health of the people, that will, we have examples like that, which policies have been brought up, and it affects the people of the, we had that in the Mahavel, when we were relocating people, malaria started spreading left and right. Because people were from the other areas, they were not immune. They just transferred them, and the malaria started spreading in those Mahavel regions. And a lot of suicides started coming up in Mahavel regions, and resettlement was done. Nobody bothered about the health impact when people were uprooted from their own traditional villages, and they have psychological implications and all that. So we have to take into consideration when we are relocating people. So similarly, we have to look at the other side. To improve the budget of the social services, we can improve that. It will improve the health. That's when building a new hospital, that money for the social services and providing some social services, looking after the elderly, setting up some care centers and things like that. That will help to improve the health of the whole people. Rather than if they don't spend that, they will become sick, and then we are spending more money for them. You got the point I'm trying to drive at. So the other sectors are very important. That's why it is called intersectoral coordination, intersectoral cooperation, working with the other sectors. Let's look at the changing context. Things are changing very rapidly now. One is internationally, regionally and nationally things are changing. What are the things globally changing? Right. Global agreement, I think one is that we have signed the SDGs. We have, as a country, we have agreed the UN that we follow the policies and follow the program for, that's why we have set up a ministry, the Council and Act of Parliament. Then external financial assistance. What is the problem with that? Now we were a developing country, so we got a lot of foreign assistance. Then we become a lower middle income country. And where are we now? We are above the low bit, just past that $4,000 mark per capita income. So we are in the other group. So still we are not very rich. But there are criteria by the development agencies. Okay, they will give more money, more funds to the developing countries. Then the low middle income countries. Then comes, so we just about this thing, So we will not get much grants and financial assistance from international agencies. Now, our whole immunization program was funded by the Devi and UNICEF and all that, whole funds. Gradually they are taking off. They are becoming a, so we have to see that we absorb in our budget the immunization program. So external financial assistance is going to come down. Therefore, we have to that will affect us running the system. Pace of technological development is globally. A lot of new technology is coming. So much of development, IT and all that. Right. Then global and regional trade is a hot topic now. Global and international trade, these various trade agreements, right, will affect us. That's why some people are protesting. And global and regional trade agreements and health diplomacy, what is called health diplomacy. We have to have relationship with the other countries. Now in this coronavirus thing also, diplomacy, our government had good relations with China. So they allowed us to, the other countries, they have not allowed to take their people back from Wuhan. So that they had diplomatic relationships. Therefore, they worked with the government to government and decided on those things. Then regionally, there are factors affecting. One is this active market for health professionals. People migrating to other countries. Because there is a demand for doctors and so forth. And the other factor is medical tourism. In our region, other countries, Singapore, Thailand, Malaysia, they are promoting tourism, and we are also trying to get that we can also promote medical tourism, and that's regionally. So that now we have to plan and have policies with regard to promoting that and like that if we want to have an impact from that. Then nationally, what are the factors affecting the health development? Nationally, prospect for increasing tax revenue. That's an important issue. We are providing free health services. Why? How? Because we from where does the money comes in? From the taxes. Okay. So, reduce some taxes, now the income from taxes, and health expenditure is on the other hand going up. So how are you going to address that increasing cost of healthcare unless you increase the taxes? So our institute did a survey last year. We put a few questions, so the health and aging survey, and we put a few questions about ask people whether they are agreement with increasing the taxes. Most of the people have said yes. They know that they are given free education, free healthcare, all that. The government needs more money. Then we ask what are the areas that the government has to spend on what they collect. They said number one, education, number two, health. So people also realize that. So what are the prospects of increasing the government is now trying to do that, increasing the tax revenues. Maybe they are reducing and maybe they, because of the elections, they are not doing that. But they become probably tomorrow, they will start increasing taxes. They have to do it. Otherwise you can't provide free education. Right. Then political commitment to increase investment in health. That is also important, and all parties are all out to help increase the health budget. Every year it has been going up, and so political commitment must be there too. That they must realize that spending on health is more beneficial for the development of the country rather than infrastructure. So, political commitment to increase investment in that. Institutional capacity is growing rapidly in the public and private sector. The future growth of the private sector is now growing rapid. So we have to do various things, and that will affect the healthcare structure of the country and the delivery mechanisms. So therefore, you have to be mindful about the fact the developing private sector, how to get the maximum from the developing private sector. And then the things, major epidemiological and we are going through really three changes. One is the epidemiological. What is the epidemiological change that we are going through? What is the epidemiological? We call it the transition. We are changing our disease pattern. It's called the epidemiological transition. What is the transition from what disease pattern to what disease pattern? Yes, communicable diseases. In the past we had a lot of communicable diseases. Now most of those are being controlled. We have eliminated smallpox, we have eliminated malaria, and several others are lined up for elimination. But on the other hand, what I mean, non-communicable diseases, hypertension, diabetes, cancers are increasing. So we are going through that. So in our health system, we have to adjust to address those national issues. Those are national. Globally also it is happening. Nationally also it is happening. Therefore, we have to be mindful about those changes. Then the other one is the demographic transition. Concurrently, that is also happening. What is the demographic transition we are going through? Yeah, we have our young population. Now it has gone up. It was like a triangle. Less old people. Now it has become a barrel shape, and now we have the top is going to be wide, and less young people, more old people. We are one of the fastest growing aging populations. That will be more diseases, more communicable, non-communicable diseases. So the health expenditure will go up. So all this we have to be mindful about this state transition. Other transition, other two types of people specify four transitions. Epidemiological transition, then demographic transition, third one they say the technological transition. What is the technological transition? Technology is even we are now digitalizing everything. We have the digital x-rays, the information systems, all that. And so that we have to adapt to those things and to use those new technology. The fourth transition they say is the socio-economic transition. Socio-economic transition. So those we have to be mindful of these factors internationally, regionally, and nationally, which affects health. And when we are developing health policies, we have to be mindful of these factors to take into account. If you are blind to those things, so if you forget about the epidemiological transition and develop policies about controlling communicable diseases without addressing the non-communicable diseases, useless. So we have to be mindful about that. That's why we have come up with a policy for control of prevention and control of non-communicable diseases. I will show you that later. Right. So this is aligning the system to achieving the goal. This is the goal: healthy lives and well-being. That is the impact we want to expect. Impact is the long term. In 10 years, we want to improve the healthy lifestyle and well-being of at all ages. People will be healthier. How do we get that? To get that, we have to have these outcomes. Health security must be there. Universal health coverage, I showed you another slide earlier, and the other SDG health interventions have to be done, and the service satisfaction. How to get that? Through the outputs. What are the outputs? Access to essential services has to be improved. We have to have facilities develop, quality of essential services, demand for essential services, resilience of essential services, for sure. And how do we get all these outputs? Outputs, these are outcomes, this is the impact. Right? So how do we get this? Yeah, these are the pillars. These are the pillars, or the inputs and the processes. WHO defined about 6. One is the national and subnational service delivery system. how is our services organized. Then the infrastructure, buildings, we need hospitals, health units, all that. Then we need the health workforce, the doctors, nurses, the paramedics, all the staff, they have to be developed, trained and developed. Then we need the support services, medicines, diagnostics and other health products. Without that we can't. So we need the services, we need the infrastructure, we need the health workforce, we need the support services, medicines, diagnostics and other. And then we need the leadership for the which is called the governance. The ministry has to be strengthened capacity to running the services. That is called the governance, for the stewardship. Right. And cutting across all this, health information is important. For all this, we need health information to manage and evaluate. And then health financing. For all this, we need money. Right. So these are the pillars of health system. On this of this inputs and processes, from this we achieve these outputs. By achieving this output, we will achieve this outcome, and through that we achieve the impact. Cool. Right. This is called the means and ends diagram, or a results framework. Results framework. Lower level results to the upper level results. Wait for the impact. So there is what is called the National Development Vision, goals and objectives. Now, who sets the national goals and vision? Who sets them? Who is responsible for the national vision, what the country is going to do in the next 5 years? Only the governing party. From where does that come? From where does the vision, government vision of where, which direction the country is going? They are the people, the party in power. From where do they get their power? From the people. So what is the document that spell out this vision and the direction? From where does it start? When do they spell that out? There are so many parties. They say they come to power, they will do this for the next 5 years. Yeah. From where does that come? Who prepares?
Finance ministry.
No, finance ministry, when they come to power, before coming to power,
People.
so document is prepared before coming to power. You have to tell the people, this is what we are going to do.
Mandate.
This is where we are going to take the country in the next 5 years. So it is prepared before they come to power. When they come to power, they have to implement and show people, yeah, this is what we told, we are now doing it. So where does that come from? Yeah. What is the document? Is there a document? Yes. Mandate. That is called the political mandate. Offer each political party has a mandate. They, when the elections come, they shout and they say, this is what we are going to do if we come to power. And ask people, okay, put us into power, we will do that. And when they come to power, they have to, that becomes the government policy. What was the government policy in the previous, before the previous government? Mahendra Chindane. Mahendra Chindane was a politician. He came when he came to the election with Mahendra Chindane. And when he come to power, he had to implement that. Then last government, what was the mandate? That's how the mandate, and they try to do that and they fail, and then people change it. What is the current government's policy of developing the country? Anybody knows? What is Violet Intelligence? What is Mahabharata? What is this government? What is the document, mandate, policy document? The government, you must know. You have your health policy should be aligned with that. You can't do nothing contradictory to that. Right. No, nobody. I'll show you. So starts with the political mandate before the election. That is called the political. Each party comes up with a party mandate. They discuss this thing and tell the people this: if we come to power, this is what we are going to do to take the country, to develop the country. Then who prepares that? Ideally, it has to be prepared with the professional academic. The current government did that. Viat Magar, they put up and they got intellectuals and they can come out with a good document rather than just start programs. So it's important that they have consulted, there are so many meetings, they have consulted the people, they have pocket meetings. For the last 4 years they have been doing that. And from that side, they have stakeholder consultation has been good. We have consulted the stakeholders and asked them, and then from that they have developed the mandate, and then from that they came up with a vision and economic policy framework of the country. That is what is the name given? Saubhagyavat, Saubhagyavat, like that. I'll show you in a little while. So this is the process. So then when they come to government, so that will give their vision. That comes from the political mandate. When they come to power, that big document becomes their vision. That statement, Saubhagyamat Lanka, prosperous Sri Lanka. So, and based on that vision, they develop the economic policy framework of the government, overall development framework for the country, and then they develop what are called sectoral policies. Each sector has to develop their own. So, health sector, we have to do it, must be in line with this vision and the government policy. We can't prepare our own health policy, it has to be in line with the government vision and the policy framework. Right? That I am trying to show the relationship. So each sector will have their policies. So in the health sector, we have a health policy, national health policy, and that should be aligned with this vision. So, and then from those sectoral policies, we have the strategies, broad way of doing things, broad strategies. Maternal and child health strategy, then reproductive health strategy, dengue control strategy, various strategies we have, broad way of doing things. And for those strategies to implement those, we have programs. So we have a dengue control program, TB control program, maternal and child health program, occupational health safety program, like that. Various programs are there based on the broad strategies to achieve this. And then under the programs, we have various projects. Project is a program is a broad thing. Within that, you can projects are time limited. So we have what is called the World Bank project, ADB project. So for specific purposes, they are given with a time frame. World Bank project for 5 years. They have given 200 billion, and they have to implement that. So there are various projects for supporting various programs. So each program will have several projects. And then based on those projects, the district, these are implementation plans. You have to prepare action plans. That is the operational level, based on the operational level policies at the operational level. Annually, we prepare action. Now you see the whole cycle of policy, and policy decides what action we do. So everything should be within that overall umbrella. Now you get the big picture of policy. There are policies and how it fits in with the national policies have been the country government. Right, so this is the document, you must read that, at least read the health sector. A vision for a resilient, prosperous country, that is the theme given to the, that gives the national policy direction. It says a vision for a prosperous nation. So this document is downloadable. I will put it, let them put it up. So what they are trying to achieve is a productive citizen, a happy family, and a disciplined society, and a prosperous nation. This is the vision there. So politicians, scholars and professionals have come together and worked out the program. They have identified 10 key policy areas, 10 priority areas they have identified from that vision, aimed at achieving the fourfold outcome of a productive citizen, a contented family, and a disciplined and just society, and a prosperous nation. These are the 4 areas they are working. So these are the 10 key policies in the vision. Priority to national security, that is important. Friendly, non-aligned foreign policy. An administration free from corruption. New constitution that fulfills the people's wishes. Productive citizenry and vibrant human resource. People-centric economic development. Technology-based society. Development of physical resources, sustainable environmental management, disciplined, law-abiding and values-based society. Right. So these are the 10 key priority areas. Where does health comes in? Which one? That is environmental management. How does health come in? Which one covers health? Anybody? Out of the 10, where will you put, where will, I will show you, where does health comes in? Development of physical resources. You could, no. Building bridges, road railways, is that health? Yeah, number 5. Productive citizenry, how can they become if they are not healthy? To be productive, you must be healthy. And vibrant human resources. Workers, people must be healthy, then we will produce more. So health comes there. To have this, we have to have health. Right. So this is narrowing down that human resources will be the, that's why now number 5 is that human resources will be the foundation for creating a prosperous country. So, prosperous country, no main key vision. So, health is very important. Therefore, human resource development will be the primary responsibility of our government. Developing the people, that's what other developed countries who are poor, because Singapore, they don't have any resources, but they develop the people. Discipline and they develop. Japan, right? That's how they develop. Korea. Develop the people, they work and country develop. So, responsibility. A wise citizen, a society endowed with knowledge. So that's why education plays an important role. Educate the people from mother's lab to teacher's care. So that's why they are trying to improve, giving various interventions. Harnessing power of youth. That's also they are going in a big way to get the young people who are very productive to come align and contribute to the development process. And the health is covered under this, health first. So health is one of the main pillars in human capital development. Health is not restricted to physical, mental and social well-being, but applies to spiritual well-being as well. Healthcare will be delivered throughout the country on the basis of a national health policy. So, This is the background to the health. So it comes on the number 5 priority area, and then the importance of human resource development in that, then only you can a productive citizen and a happy family. That is the theme for the health sector. Right. So what is the program for that strategy? It is called the SURE GV Market program. SURE GV. Time has come to change our approach from treating a patient after the disease has developed to preventing diseases by promoting a healthy lifestyle. Action will be taken to implement a change in attitudes nationwide through an extensive program titled SURE GV Market. So this is the program, a program to ensure right of the people to have a healthy meal free of agrochemicals and additives. Right? They are going in a big way to do that. A program to promote the production of organic food free of agrochemicals and additives. A program to promote proper eating habits at all stages of life, childhood, school age and adulthood. So a program to create a healthy environment by preventing the contamination and pollution of air we breathe, the water we drink and the soil we cultivate. A national program for the detection and prevention of non-communicable diseases such as cancer, heart disease, kidney disease, diabetes. Action will be taken according to the Convention of the World Health Organization to reduce smoking and alcohol usage to eradicate usage of narcotic drugs within the society. A program to incorporate physical exercise as a routine life habit. Jogging tracks, fitness centers built by us in Colombo and other suburbs will be, which receive public appreciation, will be expanded across the country under the direct supervision of the Urban Development Authority and maintained by the relevant. They have given even the strategy and the implementation also. Healthiness will be recognized as a main component of life. A program will be implemented parallel to the SURE GV program to ensure achievement of such objectives. And then how these things are, some more free healthcare system to be protected as a whole. Annual appropriation for healthcare will be increased. So expenditure they are committing that. Large number of patients, long waiting lists have become a daily challenge in the hospitals over there. This situation will be changed. Measures will be taken to enable the patient to obtain healthcare services. National hospitals will be upgraded to international standard where card excellence operates. One selected hospital will be fully equipped and upgraded to a level similar to that of the national hospital. All other hospitals will be upgraded. Modern innovations such as e-health and telemedicine will be introduced. So those are the interventions that they have built out. Okay, so that is coming from the political mandate, becoming the national policy, development policy, and from that the health policy. Right? So read that 2 pages about the health what they are doing. So you must be knowledgeable what the government is trying to do. So you have to align with those things. Then who sets the national policies? Who for the government who do the planning? What is the ministry that is involved with planning the policies and the programs for the country? Who? Yes. What is the government mechanism to develop the policies and plans for the national plans for the country? There must be one responsible ministry. National planning, that is the department. What is the ministry? In the past we had what is called the Ministry of Finance and Planning. That's how it was. Finance Ministry was named for a long time as Ministry of Finance and Planning. So till the last government, before the last government, it was the Ministry of Finance and Planning. Ministry of Finance and Planning had 5 departments. One department is the Treasury, which gives the money and gives the money. That is one department under the ministry. Then they had the Department of National Planning under the Ministry of Finance and Planning. They are the people who plan everything for the whole country. All plans have to go there, including the health plans have to be approved by them. Then they have the Department of External Resources. All the external funds coming in have to be channeled. They will negotiate with other governments and get the money to fill the gaps. Any projects we are doing with that have to go through that Department of External Resources. Then we had the Department of Fiscal Policy. Under the Ministry of Finance and Planning, they had the Department of Fiscal Policy. They are the people who laid out, prepare and policy planning all the financial matters. Various taxes and all that policies are developed by them and they monitor that also. Giving various taxes. So like that they have a this thing, but the last government made a change. They took the planning part from the Ministry of Finance and Planning and created a new ministry. Current government also continues that. What is that ministry? So now the Ministry of Finance ministry is called Ministry of Finance and something else. At one time it was Finance and because of the minister, they made Ministry of Finance and Mass Media. They were playing changing the department from one to the other. They want to keep the lotteries board and all the minister, so they brought that to this one and like that they were very big so muscle with the department. Right? Now the current government is trying to do it scientifically, dumping the related departments together under one ministry. So they are trying to hope they go like that, it's good, otherwise putting just to favor some people, some are plugged in others. It's not under the root of it. What is the relationship finance and mass media? Yeah. So finance and planning okay. Your money is needed for planning. So they are now planning is important one thing. So they separated out from it and they created a new ministry called the Ministry of National Policies and Economic Affairs. So that Department of National Planning was brought under this, starting from policies and economic. Now, who is the minister? Who is the minister of national policies and economic affairs? Previous government. Current one. So you have to read and get to these are general terms, these are very important. Who is the minister? Whom should be? Your thinking. If you are asked to put appoint minister, where will you put this one? This is the Prime Minister. Prime Minister has several ministries. This is one of the ministries. Ranil Wickremesinghe was the minister. But the work was done by a state minister or a deputy minister. He had a deputy minister. Who was the deputy minister earlier? Towards that year, the ambulance service was also run by him, not by the Ministry of Health. Now they have given it to the Ministry of Health. It should be there. It was run by the Ministry of Economic Affairs. Ambulance service. Who was that in 1990? Now they have put it in the correct place. Now they have put it under health ministry. Who started Harsha De Silva. He was the deputy minister to the Prime Minister for Economic Affairs. So he is background is an economist. So he was there, he was the deputy minister, and he was really running. Current government also, the Prime Minister is there, Minister for Policy Reforms and Economic Governance. It's important. So this is the department of, earlier it was under the Ministry of Finance and Planning, now it is under the your planning can't be there, no policy planning also has come there. Now it comes under the policy reforms. So you go to the website and blast through this. The location is still there in the old secretariat behind the old monument. Because finance and planning was there, so the location is there, but now it is under the current ministry. So this is the Department of National Plan under the Ministry of Finance, National Policies and Economic Affairs. So it now comes under, not earlier it was under the Ministry of Finance and Planning, now it's under this. Apex body of country's development planning process. So they are the people who plan out the whole country's development. Involves in policy development to accelerate Sri Lanka's economic growth and social progress. So those policies are very important, national policies. So prepare the national perspective policies, programs and projects in contrast to sectoral or regional perspectives of the issue. So look at the total country's needs and then they prepare the policy directions. So their vision is to be the most competent development advisor and facilitator to the nation. They have a vision: stimulate socio-economic development by guiding the public sector for appropriate policies, programs. So they are the leaders of guiding the country in social policies, programs and strategies. Then the role of the national planning: preparing long-term, medium-term development plans and the investment program, development of macroeconomic policy framework, review economic development policy strategies and programs, appraise project proposals received from the ministries, donor agencies. They are the people who will approve them. Review agreement received from external resources, including memorandum of understanding. They are the people who review and tell this is okay, in line with that. They do a assessment. Provision of technical inputs for preparation of capital budgets. They provide the technical inputs to the finance ministry. Preparation of project pipeline, preparation of observations and on cabinet memoranda. All the cabinet memoranda have to go through them, because they check whether it is within the national policy. Because Ministry of Health send the cabinet paper, it has to first go through this place. They must clear it and say it is within the national policy. Preparation of observations on cabinet memoranda, implementation of special tasks assigned to the department. Those are the any questions? Okay. Take a break. Take a book, tea.
Physical resources
anti-post policies and how policies are made, and the global and national policies. Let me talk to you something about looking at the policy processes in Sri Lanka and identify some good things and bad things that we have done. The lessons from this I have already covered. Concept, these are all determinants, both goals, process we have done. What I am going to discuss now is about the policy processes in the past, some history in Sri Lanka, and as we go along, I will tell you some good best practices and some bad practices and what we have been wrong and what are the lessons we can learn from them. Right. So these are the three health program a country would like to achieve. These are the three outcomes that WHO spells out in health development, what we want to achieve. One is the health outcome, that is reduce the mortality, improve the life expectancy, the health situation of the people. One is that is the main outcome, other one is the financial protection. We must make sure that people don't become poor because of ill health. Right? That is to protect them. That's why we are providing free health services. Thirdly, people should be satisfied. So these are the three broad goals that we want to achieve in terms of health in the country. Health outcomes, like reducing the mortality, long living people, for the second, financial protection, to protect people going to poverty because of their illness and without spending too much money, and then people satisfied with that. So, who are interested in the outcomes are the experts. They are looking at mostly that, okay, how we are going to reduce the burden of disease, how we are going to reduce the deaths due to illnesses. So experts are looking at that. Citizens, they are not bothered about that. They are mainly concerned about their satisfaction of the services that they get, the services that they are happy. They are not bothered about bringing down the mortality rates and all that. So they are. Then who are interested in the financial protection. Again, the experts are interested, the politicians are interested, because they want to see that people don't become poor. And so experts can influence the politicians to look at these things also. Citizens also influence, their representatives are here, they would like to address these things. Right. So what did our politicians do in the past, over the years? Since the independence, what have they done? We know. What have they done? All the governments, if you take, what have they done for years? Every government strives to give free health care to people. Right? After the by that time it was paid. They changed that and
Quality also has been improved.
Yeah.
Quality also has been improved.
Yes, in later quality improvements have become. In what else they did? They built houses, they built the other infrastructure, they improved. So those also have contributed to improve what they invested in education, they improved the education system. So they have done some good. That has an impact on health more than what we have done in the health. Those have, the education has done wonders. So we are one of the countries with illiteracy, especially among female literacy. That has contributed to a lot in that have reduced the diarrhea. Although the mothers were educated, mothers were knowledgeable, they will That's how we got rid of the diarrhea, the things, because we needed and the let's into that, and then immunization, we don't have to take it. So mothers will come and get it somehow because they are concerned about that. So that what they have invested in improving the education system. Politicians have done good by improving the free education system and giving education. That has contributed a lot for education. So like that, and they have given subsidies in the past. Free rice rations and essential items were given free to all the people, irrespective of that. I can remember always going to the depot and getting the coupon that they cut the coupon and give free rice ration. So they have done that, and that all those measures have contributed. And then impose emphasis on risk protection. Tax financing of public health, the pooling the money, collect from everybody, the taxes. Everybody pays taxes. So, even if you buy a kind of toothpaste, you are paying few cents as taxes when you buy that. So everybody, even the poorest person who buys it, toothpaste, pay taxes. Then money is collected by your brothers, they send to the treasury. So what you pay, the few cents. Right? And with that money, so it's that for this pooling the government, but there are direct taxes. Some people, rich people pay direct taxes according to their income. Poor people pay indirect taxes. They pay when they do buy something, they pay, and that money comes to the treasury. That's how this money was collected, and that money is used to provide free health care. That is what we have what is called the tax financing public sector. Tax finance is the tax-based system. Our health system is a tax-based system. Everybody pays taxes by the indirect and direct. And then all the governments, they start upgrading all hospitals. They have been doing that, and accessibility is good. So large investment in public hospitals. All the governments have been doing this. Right. Then they have removal of financial and other barriers to access public sector care, extensive delivery network. So as I said, within 3 kilometers you can get to a health facility in any part of the country. So that's the accessibility we have. So extensive delivery network is there to provide the services. And then removal of the user fees. After the independence, they removed that time it was charged, and that was removed. People don't have to pay free. So those are some of the good things the politicians have done. And also imposed budget ceiling on the Ministry of Health and framed how goals were prioritized. So because of that, in priorities were set, then money was put where the money was mostly needed. So that was a good thing, prioritizing, and little money we had, we invested in good things. So what is the result? What is the result we have achieved in the last few decades? What is the result? Three goals were there, I told at the first slide. Health outcomes, that is the health status of the people. Financial protection, patient satisfaction. How far those have been achieved? Yes, so the outcomes have increased. Our life expectancy have increased. America spends thousands of dollars per person to increase from 76 to with little few $100 we have achieved that. We are just behind 2-3 years behind America. They spend thousands of 20,000 per person per year to increase that. We have spent peanuts. Only few $100 we are spending for a person to keep him healthy. And so life expectancy has increased. Mortality rate, maternal mortality drastically come down. We are close to the developed countries. Infant mortality has come down. Fertility rates have come down. So outcomes we have, because of those what we have done, in terms of those we have got benefits. That's why they say Sri Lanka with low spending we have achieved high outcomes. with low spending, better outcomes. So, good health at low cost. We have reached close to the developed countries with spending peanuts, $100, whereas they pay thousands of dollars. Rates of medical care use at levels developed nations, but spending less than the most low income. We are spending less than some African countries. But our achievements are close to the developed countries. How we have done that? Comprehensive quality public sector care for all, but voluntary opting out of non-poor into the private sector. Those who can afford started moving, they used the private sector, and the poor people were able to get the service. All started using the free services, we couldn't have achieved that. Rationing of consumer quality, expensive, high technology services and medicines in the public sector. That also efficiency is very high. To compare even our outpatient departments, other people can't believe that we are seeing so many, one doctor sees so many patients. And efficiencies, you see, you divide by the amount of money spent for his salary and other things. With little money, we have treated so many, whereas other countries, they have to get the point, the waiting list are longer. So our efficiency wise, we are very good. Because we had limited resources, therefore we had to ration our services. Therefore we are very efficient. With little money, we are doing wonders. So policy making is very simple. Although now you have realized it's the jargon and this thing, it's like planning a vacation. How will you plan a vacation? What do you do? How will you plan a vacation? What do you do first? I want to go on a trip now. Let's after finishing. What do you do? How will you plan for it? Yeah, choices.
And financial.
Yes, you have to get the resources available. Same thing. What is the first thing? So where are you going to start? So everything where you go will depend on where you start. Decide what is the purpose, goal, what you are expecting. Is it an educational trip or is it a recreation? Right. So the strategies will differ, and then you have to plan out accordingly. So you have to have your main mission and the goal set. Okay. Now the strategies. You are going to hire a bus or go by train, or so you have to decide on the strategies. Okay. So, policy making is also like that. Let's see. Planning a vacation. What kind of vacation? That is the first question you ask. Whether it's a relaxing, educational, or an adventure. Then, principles. What are the parameters? What is our budget, your financial decisions? So, we have to work within that. You are concerned about the safety. Right? And then what else? So your principles, you have to have some criteria. I told you you have to have some criteria. Then what are the issues? Mode of travel, you have to decide how you are going to go. Train or bus or how are you going to do the accommodation? That also you have to look into. Going on several days, where will be your accommodation? Tour or solo, whether you are going individually or a group, and then about if somebody becomes sick, how are you going to get the health care? Then what are the options, your strategies? What are the realistic choices that meet our objectives and principles? So that you have to decide the strategy. And then you do the confirmation, bookings, reserve the flight, car, or the hotel, etc. So, planning your vacation is there. So, compare it with policy making. Your objectives, whether it's an educational tour or adventure or recreation, those are your broad goals, what you want to achieve from the trip. Do you want to go and visit health services in the community or education, or you just want to relax and enjoy and come back? So, policy making is also like that. You have to set what you want to achieve from your policy. Then the parameters. So, in the objectives or in the policy also, you have to have the policy principles, basic principles. What are the basic principles? In any policy, there are very basic principles. One is equity. The policy should, that's the basic principle you have to work in with. Everybody should be treated equally. Fairness. That's the principle. So we value the local initiatives and things like that. So principles. Food, your health should be, you spend healthy food and no alcohol, not smoking. Those are how the principles like that. So in policy making also, you must lay down, these are the principles that will help govern the policy process. Then the issues. Same again in the policy also, here also traveling, your accommodation, all that, healthcare, all that. Like that you have to look into the issues you will face in the policy making also. What are the issues that you have to address from your policy? Then what are the options, your strategies? Same policy also, that's it. So you are going to do. And then for final bookings, that is your action steps. Right? So policy making is like planning a vacation. So this gives the stages of a planning, the policy process. Start with agenda setting or identification of issues or problems. Any policy starts with a problem or an issue. So first thing is for you to do is, if you want to make a policy, look at what is the problem you are going to address. You just bring a policy just because you want to have a policy. There must be some issue or a problem. So then that has to be very clear. You have to identify that. So your policy should address that. Then you start, once you set up your agenda, you are going to develop a policy, then you formulate the policy. This is the formation part, this is the formulation part. Then what is the next step? After formulation? Formalization now, adoption, policy adoption or legitimization, or you can call it formalization. Once it is approved, then you implement the policy. After implementing, you have to assess and evaluate, and the cycle starts. So simplify the whole policy process is there. So you have to learn, remember, draw this and few diagrams. If you know the policy, the classification of policy, that's all you have to do. You don't have to cram all this, right? Think rationally and few diagrams, you can answer any policy question. So this is another classification of the policy process. It covers the everything, that much better. Again, the problem identification, start with that. Then they put policy analysis. That is the formation and the formulation part. You have to analyze current situation and then analyze and see what are the factors affecting. And then based on that analysis, you develop the strategy and the policy development. It is the formulation part of it. And then formalization, policy enactment or legislation or policy approval. Then you implement. What is missing? After implementation, evaluation. Evaluation is there. Here. Throughout you have to do monitoring and evaluation. The process you have to evaluate as we go. So that this is. And important thing is, I said, your policy processes, stakeholder engagement and education is very important. That is why many policies fail, right? These trade agreements, because they are not educated. People are not made aware that this is useful for the country, this is what they hide things and then people protest. So if you involve from the beginning, get their concerns also, and then you can develop a good policy. So this is a nice diagram. You remember this whole policy is summarized here. Right? So you master these few diagrams, you can answer any policy questions. Let me give you a simple diagram, the dimensions of analyzing public policy. There are 5 dimensions when you analyze 6 dimensions in analyzing public policy. You have to look at the effects. You have to look at how the implementation and the sustainability, durability. So effects in terms of effectiveness. What does the policy have on the targeted health problem? How much the policy will help to solve that problem that you have identified. Unintended effects. What are the unintended effects of this policy? That also you have to look into. That's why the Matala, there were so many unintended effects. It disturbed the environment, and then suddenly birds come and sometimes white crash also, very dangerous. So those were unintended, then they thought they never thought, because it's the area of bird sanctuary they used for that. So, and then the equity. What are the effects of this policy on different groups? Everybody must be fair to everybody. That's a policy goal. So that you have to look into the affecting some people favorably, some people unfavorably, then it's not a good policy. So you have to ask that question. Then with regard to the implementation, you have to, when you are developing a policy, you must look at the cost. What is the financial cost of this? Not to develop the policy. After developing that policy, put it into practice. If it costs a lot of things. Now, then the previous minister was trying to introduce genetic molecular, right? Because the PGI has trained and given some MSCs in this thing, because they are not 14%, they are not used for the purpose they are trained. So we want to see cost benefit can be there are more pressing things we need to first address rather than try to set up genetic publicity. So financial cost of it will cost a lot of cost for the equipment and to set up such facilities. So there are more pressing things to be addressed. Then feasibility. That also is this policy technically feasible. Sometimes the policy may be good, but whether it can be implemented. So that also we have to think before coming out with a policy. Acceptability. Do the relevant stakeholders view the policy as acceptable? That's the importance of involving the stakeholders from as early as possible, educating them about the policy. That's what usually they publish in the papers, but people don't read. The website and just put advertisement, it is there, your comments are welcome. We have to have a dialogue and meet different types of people and educate the people about that. Classic example is in Colombo to Clayville, there were so many shanty areas. So the government decided to put up prime land occupied by the large number of these poor shanty dwellers. So they wanted to clear them and put apartments to be given to them. What happened? They went and tried to remove the people from those shanties. People protested. So sometimes they go, the following day come back and put up the shanty again. It was happening several times. Then the Indian government gave a grant. You see, Iran also beautiful. So very tax-time also. They got out the Indian. Can even get in 2-3 years. So how did they manage to get that done? So they went to those shanty areas and educated the people. They told them that this land is valuable for prime property. This is for the good of the country. Prime land, there's a lot of investments and on it, and then the country will develop, then you also that will develop. So it's for the good of the country that you have to give up these things. And they promise that they will give everybody apartment was guaranteed. So they are the list, they say, okay, there. Then where are they going to stay during that time? So they were given alternate accommodation till the tax service. After that they moved and these places have come up. So see the difference with the educating. So when you are going to have a policy, you have to educate. And then they that's what the 97 Presidential Task Force failed, because they didn't involve the trade unions at the beginning. They were called to the parliament and given a copy and asked to give their okay to sign the. They said no, this is the first time we are. And it was a failure. They protested. Right. So this thing acceptable. So these are basic, and also the durability, the long-term sustainability, whether we can continue. So these are the 6 areas, relationship between the 6 analytical effects and the implementation. In the effects, effectiveness, when you are implementing, you have to concern about the cost, acceptability and the feasibility. And then the effectiveness, unintended effects, equity. Those are the 6 parameters when you are analyzing a policy. You have to look into those 3 areas, whatever policy you are developing. This is an example of a logic model, right? How a policy helps to change things. We are going to change the behavior and some impact, change the situation from a bad situation to a better situation. That is what policy is about. To change the situation, to improve a situation from a worse situation to a better situation. So this shows that public policy or decision was made to about nutrition labeling. It was brought about because we saw that a lot of obesity was going up in Sri Lanka. So recent survey shows the school children, especially in the urban areas, they are becoming obese, and so they tried to introduce that. That one classic example is that traffic light for the sweetened beverages, they introduced this traffic light system. Similarly, they introduced labeling, nutrition. Now we are going to introduce other nutrition values. Other countries have done that also. So we have introduced 2 things. One is that traffic light system, orange, green and red. If sugar is too high, red. So now people are a little concerned. They look at that and if it is red, they are a little reluctant. They don't know what is people like. So, so there's something like that. That is a policy decision to do labeling, and it was made by law. It was made compulsory, formalization, and policy instrument was the law was brought in, and then educated the public. They understood, and they are now better informed. People now look at the traffic lights, if there is a drink, and then they go for less sugar one, orange or the green one, because they were educated and the law is there and they are labeling. And then diet became healthier, and then the obesity came down. So see that the policy has had an impact of reducing, trying to control. So they are going to bring in some other legislation about nutrition labeling. Right. So policy process, I discussed this. There are 5 technical processes: policy formulation and legitimization. Start, formation, formulation, formalization, that is the first step. And then after that you have to do what is called constituency building. This is the advocacy part of it. After you develop, you have to educate the people. That many people, many governments made that mistake. They didn't tell the people about the policy. ICTA is a trade agreement, and they kept it a secret, and the people protested. So they don't know what they people shout. So that is called constituency building, that is educating and you get people onto your side. Then resource mobilization, that's also very important. When you develop a policy, you must see that to implement the policy, you have enough funds lined up for the next few years. Otherwise, you will have the policy, but you can't, you have no money budget. So that is called resource mobilization. Then implementation, design and organization, you have to set up a mechanism how to implement the policy, focal point and the structure to implement the policy, and then you monitoring the. So that's another way of looking at the policy steps. Right. So policy process has start with the issue, you set the agenda and you make decisions. So this part is usually politically driven. When issues and agendas come together, policymakers make decisions. These political decisions are often result in a new policy, but rarely specify the details of implementation. So then the policy, the next part is the technically driven part. This the policymakers make a decision. Okay, we need to have a policy on this thing, and then the expert will come together. That part is technically driven part. So this is how it is divided into two parts. This is the policy making. This part is the first part. It is usually politically driven. Identifying an issue or a problem, and then they decide we will have to have a policy. They can't develop the policy. They don't have the expertise, technical knowledge. So this below that, after you decide to have a policy on that particular, then the technically, this part is technically. Technical people have to do that. So let's look at what are the ones. First, I said policy process starts with the issue, identifying the problem or issue. That is the starting point. Then you set your agenda. Okay, for this we need to set up a policy mechanism. You set that agenda. And then you make a decision that you are going to develop a policy. That part is usually political driven. Then you get the political commitment also. But they can't, the politician can't be doing the policy part of it because they need the technical knowledge, know-how. So they don't have that capacity. Therefore, the bottom part is technically driven. So experts will come there. So policy formulation and then get the approval. This is the formation, formulation and formalization. After that, what will you do? What is this next box? I showed in the previous slide, the 5 steps. Once you get the approval, before implementing, what you have to educate. That's why, right? That is called constituency building. Educate the public. As once you like this is the policy, this what will have happened, it will be beneficial for the long term, or that you have to educate the public. You have to do a campaign, actually, advocacy. That's called advocacy. Then, one other important thing, before putting it in. The previous slide, I put it up. Resources, mobilizing resources. Resource mobilization. You have to, policy is there, but if you don't have money to implement, no point having a policy. So you have to ensure that the treasury allocate money to implement that policy. Resource mobilization. There were examples of specialized units put up, but no staff was not there. It was building already, equipment was ordered, but no staff, trained staff. It happened linear accelerator at Maragam Hospital. Linear accelerator worked several years, it was idle because there was no trained people. Then from WTO we got down to Indian and we had the salary from WTO and started the machine working. We have trained the person. So you have to mobilize human resources, financial resources. Then only you do your implementation, design and organizational structuring, and then you monitor and evaluate it. So that completes the policy process. So draw this diagram and study this and keep in your mind. If you have any police question, you put this and this study. Police speaking model, politically dominated part, technically led part. These are the circle diagram and this one. Let me take you to the history now, as I told you in the morning. You said policies were developed in the 90s. I said, even during the king's time, how can you prove that? What is this? This is the first hospital evidence, where there is evidence of the first hospital in the world. So we had policies for patient care. And how many of you have visited this? Where is this? This one. This one. Oldest hospital document where there is evidence. There may be have been other hospitals, but still we have the evidence that it was a hospital. Beautifully, when you go there, you can see the urinals and the isolation areas all nicely demarcated. In the ruins you can find how these areas are decided and they hit over the rock made of rock is there, still there, it is there, you can see that. How many of you have gone to Mihikale? Others have not gone. Those who have gone, you went to the top. But before going, you need to look at this. This is at the foothill of the first you go there next time. When you go, if you have not gone, go there. Go and see this before climbing the rock. It's at the foothill of the Mihikale rock. Down there. This is 4th century BC. So we had policies, right? We were as far back then. Then this lady has written books. 2 books I will show you. One is Health Policy in Britain's Model Colony. So she says that there have been various policies. She analyzes in Sri Lanka before, during the British period. When the British came, when the British took over from the Dutch, Portuguese came in 1505. When the Dutch came, when did the British took over? This is common, your IQ, common general knowledge. Good children will tell you. You didn't have the history. We had history. Now all natural sciences. These were taught drilled in your heads. 1850, right? 1850. So she has studied from 1900 to 48 when we got the independence. Margaret Jones, she has written several books on the history of medicine. Discusses with the British contemporaries, Sri Lanka, whether Western medicine was a positive benefit to colonialism. And then during that period only Western medicine started coming in when Western medicine got introduced. Before that it was traditional medicine, Ayurvedic medicine practice, indigenous medicine practice, before the Portuguese. With Portuguese, Dutch and the British, the Western medicine also started coming in. So the research for this title is underscored by a detailed analysis of public health policies in Sri Lanka. She has studied. There had been policies in Sri Lanka. Right? And this is another book here, The Hospital System and Healthcare. 1815, that is the time the British came in, to 1960. But in this, this is the Victoria building at the Lytton Circus. I have been telling from 2011 or the people to make it a museum. And the director research was, I told him, he said he's like do that once they shift there a few units there, house there. Because the railway, postal, all they have a museum, but the health, with a long history, we don't have a museum. This is ideal, really. 1902 or 3, I think they have set up this university. During our medical school days, this was the accident service. We used to go and shoot the woods there. And there's some work done by Soma Heva. He also has written some colonialism, tropical disease and imperial medicine, about the policies in Sri Lanka, colonial policies, European policies. And then this person is a doctor of public health from Rockefeller, from Australia. He came and helped with the eradication of hookworm death and this thing, and his experience in the American South helped developing Rockefeller Foundation, public health programs conducted, and then these are the people, the first health unit in Sri Lanka, the MOIT office. Where was it set up? When was it set up? The current, it works very well. The MOIT, or the preventive health system. When was it started? Long before Almata talked about private healthcare, we started private healthcare. We did in 1978, private healthcare. We started private healthcare as long as 1926, the first health unit was established in Alutara. Still that building is there. Right. Then in the early 1950s, this person from Australia was brought, Constant. He studied the whole system, and that is the basis of the current system. Because from his recommendation, there were several things was adapted, and from that the health services minute. This is the governing document, legislation that helps to implement the health policy. The Health Services Act, or they call it the Health Services Minute. It has been amended from time to time, so still that document is the one. And then 54, up to 54, everything was controlled by Colombo. 54, they appointed the regional RDHSs. That time they divided into 15 areas and appointed 15. They were called Superintendent of Health. That was the first decentralized health services. That was a policy decision to decentralize. It was covered, not from the health ministry, everything, from the over the country. Then SHSs were appointed to run the services in those areas. So those are what it. Then before 1966, Ministry and the Department of two things. In 66, they appointed Parliament, appointed the committee to look in parliamentary committee to look into the ministries of and the department of the government sector. They studied and they said one of their recommendations was that ministries like health and education, agriculture should not be separate. They should be amalgamated. It should be together, because a lot of technical things are involved. If the ministry is separate and this thing, it will not function. So after 66, they merged the department and the ministry together. Now, is there a separate department? No. Director Health Service, Director General of Health Services is, and there is a Ministry of Health. There's no Department of Health Services. Although name is there, but there's no separate. It's located in the same building. Communication goes up and down. So, because of several reasons. In 99, the minister wanted and got a expert to analyze. He studied and he said, if you are going to separate, the minister wanted to separate. And the expert who studied Shelton Mansingh, he said, we can separate, but ministry should be involved only in policy decisions. Implementation should be given to the department. Ministry should be a small unit, not a big. By that time, when it was, when the minister wanted to separate, it separated. When it was separated, there were 726 people in the both of the ministry, department and the ministry. So what the expert recommended is the ministry should become small. Instead of becoming small, ministry started growing because they could not do the work when the department was together. The technical things, they what one doctor or the technically qualified person does, they need 4 or 5 people to do that. Ministry try to do that. With it together, it's very easy, and then lot of cost was involved. And so then January 1st, 1999, they sent a circular. From 1st of January, the ministry and the department separated, and a lot of things were happening, and the delays were happening, and then they didn't listen to us. I looked at the past and got hold of this white paper of the committee. Exactly what they have said are happening now also. So nobody had looked at that, and they have said because of this reason this should be together. Now when it is separated, what happens? The letters from outside, from WHO, comes to the secretary. Secretary puts it to the additional secretary. Additional secretary puts it to the senior assistant secretary. They set up another planning unit. Earlier it was one planning unit for the whole ministry and the department. Then now we have a planning unit for the department. They created another planning and monitoring evaluation unit in the ministry also. It was a non-technical person. And that person looks at it, and secretary, earlier the planning unit of the department, looks at everything and takes action. So this one then prepare a covering letter, attach, photocopy all that documents, and then send it back, and it is sent to the director general. Director general put it to the deputy director general, it then goes to the relevant director. Then only action starts. You see how much time it would have taken to do that. We lost so many fellowships and training programs of God because there was sometimes not enough time. So this was happening at 2008, and told him we lost so much of things, and then we were able to convince and they amalgamated again. Then the Alma-Ata Declaration, and we signed the health charter. We agreed and followed, and we had a lot of achievement improving immunization, planning, everything. And then 87, as I said, the 13th Amendment, decentralization, provincial councils were set up, provincial ministries of health were set up, provincial department. This is the health policy document I told you from the 92 task force. We prepared, it's about 5-page document. Called the National Health Policy. That's a political policy statement of the health sector. It gives you the current situation, the priorities, provincial goals, and the broad strategies how we are going to implement them. Based on that strategic plan, so then health master plan, that's another plan. We prepared a policy document and a master plan. And the current one is this one. National Strategic Framework for Development from 2016 to 25. That is the current policy document. It's in the website of the Ministry of Health. How many of you have visited the Ministry of Health website? Nobody. Okay. Go to that website. There are a lot of documents, policy documents. There are publications under that. There's called all policies are put in one document. So all the policies are there if you want to refer for your studies or projects, you can use that, and there are a lot of material there. So this is the current website, the strategic plan is there. Then there are other policies I told you, showed this slide for different subjects. And this is the document which they have put together all the policies. This is up, I think, about 3-4 years old now. Up to that point, all the policies are there in that document. You can download them. So finally, what are the factors that contribute to successful policy making process? I discussed this in the morning. One is political commitment. Secondly, policy formulation, have a committee or a task force. Then a co-group or a technical group. Focal point, time frame, present situation, exist document, review interview of a position papers. Then consult all the stakeholders. Implementation factors you have to consider. Publish and widely circulate. Educate. Okay. So these are some good policies documents I have studied. One of the good early policies was this population and reproductive health policy. It's a good document. It has a strategic plan also how to implement, and it has been implemented, and we have got the results also with regard to population and reproductive health. Then the 92 task force report which I talked to you about. That 96 policy statement came at that, and then the health master plan. The first chapter is the policy part of it, and another one, recent one, is a few years ago we developed what is called the migration health policy. That's also good policy document, followed the different stages. So this is the health master plan 2007 to 16, summary document. Healthy and dynamic. This is the migration health policy. So task force was established from all the people from different agencies, Foreign Employment Bureau, Customs, Finance Ministry, Ministry of Health, Labour Ministry, all the people concerned are in that group. So they had a national steering committee, and they had a secretariat in the ministry, and then the task force, and then they developed this policy. Okay. So policy formulation is a complex process, but it's simple as like planning a vacation. You know now the steps. I have simplified it. Right. Okay. But I will not be able to do. Hello. Other thing is I have put the handout there. Is about the toolkit I covered in that presentation. This also I have put there. I think it's that diagram I showed you, the politically driven part, and so this one, and the technically led part. So that is what I call the toolkit. What I couldn't do is I'll quickly run through. You can read about that. This is an important area, stakeholder analysis. How to engage the stakeholders in the policy process. Right? What is the stakeholder analysis? It is looking at the stakeholders. Who is a stakeholder? Is a process systematically? You have to systematically do it. You can't just ask questions and this thing. You have to do systematically, look at who are the stakeholders, correctly identify them, look at what they are interested in and what are their affiliations, all that. So determine whose interest should be taken into account when developing and or implementing a policy or a program. If you are planning a program or a policy, you have to consult the stakeholder. That is the important message. What is stakeholder analysis? So you have to look at their characteristics. You must know your stakeholders, understand, study them. Then especially those people who will get negatively affected by your policy. People who benefit from the policy will make no sound. So you have to be careful about the people who get negatively. You must study them and try to get them onto your side. So that's why analysis is important. You have to study them. Stakeholder identification. First, you have to identify who are the stakeholders. But when you are going to do a project or develop a policy, then assess their interest. There are various tools for that, and the ways in which these interests affect the project riskiness or viability, your policy, how their interest will affect your policy. Right. All this will be put on the your website, or you can copy from this. I have put it here. If you have the pen drive, you can copy it. So stakeholder analysis, you're looking at the stakeholders and collect various data in designing this thing. Who is a stakeholder? Stakeholder in a process are actors. It can be persons or it can be organizations with a vested interest in the policy being promoted. When you are developing a policy, who are interested in that? That's why the people, when they do trade agreements, they have to consult the stakeholders, the people who will be affected. They didn't consult the doctor. The GMO came in a big way and try to this thing, because it will affect their practices and these things also. But you have to get them on board and explain to them what they are going to do and how it will affect, and get their views also. So that was not done. That's why they are protesting. These stakeholders or interested parties can be usually grouped into the following categories. Right. So you have international donors. That's one group. You have national decision makers, the politicians and them. Then we have the public ministry, different ministries. Then there are labor unions, professional organizations, then private organizations, NGOs, civil society. So these are different types of stakeholders. So stakeholders are persons, groups, or institutions. You can divide them into firstly 2 or 3 categories: primary stakeholders, secondary stakeholders, tertiary stakeholders. Primary stakeholders are those people who are directly affected. There are indirectly affected people, they are secondary stakeholders. Then remotely, there is no direct anything, there are involved other tertiary stakeholders. So identifying stakeholder. First you have to identify the core issue. When you are developing a policy, what is the problem or the issue? Then you look at who are the people who will be directly affected by this issue. So those are the primary stakeholders. Right? Those are the primary stakeholders. Say you are going to widen a road. Who are the primary stakeholders immediately? Who will be directly affected? People who are living alongside. So, right. So these are primary stakeholders, directly affected. Some people will benefit, some people will be negatively affected. Then those who are indirectly affected, whose livelihood are indirectly affected, they are the secondary stakeholders. Then those who can influence, they are not affected, but they can influence. Can you tell me one important party who can influence the other stakeholders? These are called tertiary stakeholders. Who are those? One important stakeholder, you forget, you have to get them involved, otherwise they can kill or you improve or destroy your policy or the project. Who? The media? You see, they have a lot of power. They are not directly affected, they are not indirectly affected. But so you have to tackle the media also. Right. Educate them, have a press conference, tell them beforehand. That's why those people have press conferences, educating them and get them on their side. Right. So those the stakeholders, primary stakeholders who are directly affected, secondary stakeholders indirectly affected, tertiary stakeholders who are not affected. So then you look at the characteristics. You have to analyze. There are various techniques. One, I will show you one table. So you put down, list out the stakeholders, and the process of stakeholder analysis. Using a table, you have to analyze all the stakeholders. Now this is the table. This is the process, so we discuss that. Then you identify the stakeholders, then this is the table. So first column you put down the ID number 1, 2, 3 like that. Then the position in the organization. Position and external or internal. Whether the stakeholder is internal. Now, people working in the health sector, if it is a health policy, they are internal. Other people are external. So that you have to identify. Then the knowledge. How much they know about you must know that to educate them. How much you know. You can grade them into 3 to 1. If they know a lot, then you could give 3 marks. Do a little, they will give 1 mark like that. In the definition. So then the position. Then their interest, whether it's positive or negative. Organization, when the quantity and ability to influence, like that, there are various characteristics. You can put that map out and then select, decide on the this thing. So each one is now explain how to fill this form, ID number. So one by one, it gives you explain each box how to fill that rating scale and all. Right, and then you do a mapping of this and then select the stakeholders and educate them. Right. Any questions? Right. Then before finding out, let me give you some homework. Next 23rd we are having that. In that we are going to discuss about, I will present the Sri Lankan health system, and then you will present health system in different countries, right? What are the countries? You had, how many of you, 2 people left, no? 1, 2, 3, 4, 5, 6, 7, 8, and 10. Right, okay. Who is, who likes to study the US health system? Anybody? Anybody? Any takers? Everybody has to present. Okay, you take UK. US, huh? UK. You want to do the UK. France. France. Somebody should take. Not that difficult. And then study and comment. 3-4 flights. You make a presentation, 5 to 10 minutes presentation about the system. Only 1 minute. France, somebody is to take. Okay, you are doing France. Australia. Okay, Australia. Canada. Okay, you do Canada. Japan. Who's left now? Japan. Okay, who's interested in the Japanese health system? Interesting. You don't have to spend much time, half an hour to 1 hour, you can study the system and come and make 4, 5 slides and present this is the system. Canada, Japan, anybody? Who has not taken now? US, who's US? You are in US, UK, right? France, Australia, Canada, right? Okay. Japan, you are left. You have taken, also you have Japan, right? Who else didn't get all of you? What are you going to do? You can take any of these. You have a choice of any of these. So you team up with somebody else who knows you can meet or discuss. I put it on the caption that select anything. Okay, UK. You must know that there are a lot of your ladies go to UK. So knowing that will help you. Those are the most elite. Right. So the 2 others who is known to you, close to you, when contact you, you have the email. Right. You can tell, right? Okay. What is your What is your country?
France.
France. Ask her also to prepare on France, right? Two of you.
Two separate presentation or
One percentage is both this. Both of you have to present. Either you can divide the percentage twice, and both of you can present the same percentage. Part you present, and one person present the same. Other one do a small discussion. Positive. What is your Australia? Ask her also. If you have to look at the Australian health system, and two of you have to present Australia. So, any others who have not come, who are coming next time, then you have two people, each one of you, right? Okay, so come prepared, 5 to 10 minutes presentation. So we will look at, then I will summarize, compare all these systems and with the Sri Lankan system. So that is what we are going to learn next time, and then I will talk about the international policies and international organizations. So that's our, we will complete our other health systems. Okay, any questions? Okay, so we don't have to cram all these things. I'm sure all of you would have listened to a policy lecture for the first time. This is not a subject taught in many courses. So it's an important area for health administration. It's important at your institutional level even, knowing about these policies and issues for your careers. Okay, all the best. Thank you. Then